It's the cold hard truth. Everyone really want to know what's going on with her show. Just get on the air and you will know it's Sandra. The queen of the mile road is here, helping people from everywhere. Get on the phone and you will hear Sandra. Now she will tell you how it goes, but don't you ever step on her toes, 'cause you will hear the cold hard truth from Sandra. They say she's the hero in town, helping people from all around. You get a call, your money is found, it's Sandra. Some will call her late at night just to say that there's a fight, and she will not just leave it alone. She'll get up and call on the phone, and when politics starts on her show, everyone really wants to know the way the things will really go with Sandra. Some will start to criticize, get on the show and tell pure lies, but someday we'll realize it's Sandra. And when they start to argue again, she'll pull the heads to the wind, and soon you will be a friend of Sandra. 'Cause every day everyone wanna hear from Sandra. Every day everyone wanna hear from Sandra. 'Cause every day everyone got to hear from Sandra. 'Cause every day everyone got to hear from Sandra.
Good morning. Good morning. Happy Tuesday, everyone. How is everybody doing this beautiful Tuesday morning? Bit of good news. We are actually back on the regular YouTube channel. So I'm going to give you guys time to transition over. I didn't even know that it was back to working, but there you go. So I will keep all of you abreast and updated. But yeah, seems like I discovered it accidentally last night that we are back. Nonetheless, everything remains the same in terms of our backup channel. We'll use that for today, as well as the regular channel. And then in a couple days, we'll just be on the regular one. The backup one is really intended just for backup purposes only. In any event, I am pleased to have in the studio with us this morning. Of course, it is Medical Rundown Tuesday, so we're going to be talking to the good folks over at Health City. And yeah, we've got a good show lined up for all of you here today. So let me just grab some links very, very quickly. In the studio this morning, we are going to be discussing life-threatening conditions. Now, I know this is so incredibly serious when you have to, do a visit to the emergency room and you have to, have access to cash Uh-oh, looks like we were having a little issue there. Dr. Andres, if you can just unmute yourself. I think my mic was auto muting. I don't know what was happening there, but I think we've had you actually, Dr. Andres Martin, on the program before. So
Yes.
welcome back. Thank you so much. Tell us a little bit about your background and your experience so that our listeners can know exactly who you are.
Yes. Thank you for having me back. Yes.
Yes.
I'm an emergency consultant, emergency physician. I've been working in emergency medicine for, I'm afraid, a long time, more than 30 years. Yeah, I know,
Yes.
time passed. I've been working mostly in the UK, in some of the teaching hospitals there as an emergency physician. Uh,
Mm-hmm.
Also working on major incidents and also working in many other type of roles like managerial roles, like a big medical director, divisional director, leading some of the big emergency departments in London for
Mm-hmm.
20 years. And also as a sideline, also I've been working for 20 years. I was one of the doctors for the Arsenal Football Club. Then I
Oh,
also
wow.
yes, I also work in the stadium to try to deal with all the emergency that usually happen in all these big events. Then yes, I've
Uh-huh.
been around for quite a while, and now I'm lucky enough to be in Cayman and working with Health City in the emergency department. I really am delighted. I've only been here in the island for 3 months, and it's been a fantastic time. It's been
Yes.
incredible.
Well, welcome.
Love it.
Sounds like such an amazing career. And of course, that makes you an expert on today's discussion with all of the, emergency experience that you've had, emergency and casualty
Yes,
experience. So we're going
yes.
to be talking about how to spot a life-threatening emergency. This is really, really important. Do you find that oftentimes, because we know, of course, once it's life-threatening, time then is of the essence, right? Do you find that people miss signs?
Completely. Yeah. Oh, I
Mm-hmm.
mean, sometimes professionals, but mostly people. People, there are many reasons why they just underplay the whole thing because there's a denial, because but very often we just think that, oh, we know what emergency is. I see on the telly, it's very dramatic, it's very obvious. It's
Mm-hmm.
I will always recognize that I'm very, very sick. But in reality, this is not true. The
Mm-hmm.
vast majority, or very often, most of the life-threatening conditions at definitely at the very beginning start very
Mm-hmm.
subtle, very quietly, not very
Mm-hmm.
dramatic. And that is the problem because they tend to be time, they are the time is of the essence here. If you have been treated in the window of time, you got very good
Right.
chance to recover. If you miss that window, you really this become, and that's what happened. The people think it's very obvious. I would ever recognize an emergency, but in
Mm-hmm.
fact, as I said, most of the time is much more like in the next slide. Is much more less dramatic. It's much more subtle. It doesn't feel
Mm-hmm.
well. It's, and,
Yes.
and and that's the problem. And one thing they always tell me, oh, I didn't want to bother you, doctor. I didn't think it was anything there. And that's happened again and again and again. And say, why you didn't come any earlier? And that's
Mm-hmm.
very often. It's very common. Very common. They don't recognize that they are that ill. They know they're ill,
Mm-hmm.
but not that ill.
Yeah. Wow. All right, folks, we're going to be giving some tips here with
Yes.
Dr. Andres and how to recognize these things because, again, undoubtedly, time can really make a difference in your prognosis and sometimes even save your life. I mean, we have a very, very personal experience that hits hard, close to home, where a close family member of my husband's ended up dying after a coronary event. And the truth of the matter is, for months, he'd been complaining about very subtle symptoms and pain, Dr. Andres, you'd be shocked to hear that in our family, we have, our sister-in-law is a casualty nurse. She's EMT, like she works in emergency rooms. And so he was ignoring the symptoms and had traveled and spending time with her and his son, and when she saw him and what he was complaining about, where he was complaining about the pain, she said, I feel like you should be getting a checkup in relation to your heart. You need to go get this checked out. Don't take this lightly. And unfortunately, by the time that he got home, the symptoms not only persisted, but started to get worse. And so the night that they got worse, of course, then you fly into the emergency room and, then it's a day later, it's too late. But literally, there were signs months before. So we're going to talk about, folks, why the reality is that some of these things are very quiet. They're very subtle. It might be pain in the shoulder and the neck, certain things with heart attacks. Women present differently than men. So you've got to pay attention, because your body, in most instances, your body is going to be giving you signs that there is something amiss that you really, really need to pay attention to. So why do people miss or delay seeking care? The doctor just touched on it a bit here. Sometimes you're in denial. That neck pain. Oh no, that's me working out too hard at the gym. I'll remember a former politician. Years ago, he had a near life-threatening emergency as well, where basically he had a blood clot, deep vein thrombosis that was in his leg, and it was traveling. And he said, of course, he's high-risk smoker, drinks, not the best diet, overweight. And he said that when it happened, when he first kind of really noticed it, the swelling, the like, ooh, something's in my leg. He actually thought, it was just from the gym, because he had recently started going back to the gym. And so he misread it as, it's just swollen because I was working that leg out too much or whatever. And he was prepared to ignore it. And once again, someone saw him and they looked at his leg and they said, you shouldn't ignore this. And he went in and they're like, if you'd waited another 24 hours, your prognosis would be, unfortunately, somebody planning your funeral. So pay attention, folks. These things are very important.
Yeah, and I just say it's all this denial, this uncertainty, and we think we know quite a lot, but it's lack of knowledge too. It's interesting to know, and I learned this also when I was preparing for this. 50% of the American citizens do not know the heart disease is the leading cause of death. 50% of the population don't know that.
Yeah.
In Cayman, for example, is the leading cause of death. 27% of the death in Cayman are all due to strokes or heart attacks. 27%, a quarter of all the death. And very often we don't know these things. Very often we assume it's somebody else, and that's the problem.
Yeah.
And the three things we're going to be talking today is mostly about is heart attack, is stroke or brain attack, as I call it, and sepsis. Heart attack is the one that the people think, I know what it is. And it's quite simple. I mean, a heart attack, what it is, it's a block on the vessels that go into the heart. The blood doesn't get into the heart, and then the heart muscle, they just die. Heart muscle, like the brain muscle, is one of the part of the body that you cannot repair. If you lose it, you lose it. Then it's very important that if we think we got somebody that have a blockage in your heart, that's the time critical. We got a window of time where we can treat it before the damage is going to cause in the heart. It's going to be too much. And we can treat it in that window. We can treat that. We do that every single day. But the problem with for example, with heart attack is, as you say, the symptoms. We all thinking, I will recognize that I got a heart attack. I've seen it. I will have this awful pain in my chest. I'm going to collapse. It's going to be so obvious. And as you mentioned, your example was a typical one. It's not that obvious. Very often, it's just feeling a little bit of pressure. Women, as you said before, behave differently. It's not as common in women to have a very severe heart pain, chest pain. It may be more dizziness, maybe you'll feel tired, maybe more back pain than the typical chest pain. And all these symptoms are not as clear as the people think. And it's true. Most of the chest pain, thank God for that, when they come into the emergency department, 60-70% of chest pain is nothing to do with the heart. Yeah, we know that. And most of the time, we're very good to tell us, look, don't worry, you don't have any problems. But to recognize that having a heart attack is not just to have a very severe pain. For example, if you got diabetes, it's very likely you will develop a heart attack with very little pain. It's called a silent heart attack, or no pain at all. Then don't
Mm-hmm.
rely only on to have this. Yeah, I will always recognize the symptoms for the heart attack. And the key
Yes.
part here, and all the three things that we're going to be talking about, is time critical. If you think you got a heart attack, you think you may have a heart attack, you think you got a problem with your heart, you need to go to the hospital very quickly, because that window of time is critical, a few hours. We're already in the hospital to receive people with strokes, with heart attacks, to be able to treat them very quickly and unblock this artery,
Mm-hmm.
unblock this vessel, to be able to restore the blood to the heart. And we can do it. We're lucky enough nowadays that we can do it with drugs to be able to dissolve the clot, or better with that, we can just put a little wire. It's like a plumbing where you put just the wire through your sink to unblock it. It's similar to that. You can unblock it through the wire, and that you will have a team waiting for you in the hospital for that. But for that, you need to be able to bring to the hospital, to come to the hospital.
Mm-hmm. Mm-hmm. Hmm.
Yeah. The other thing
Very,
that the
yes.
yeah,
Mm-hmm.
yes, go for it.
No, I was just saying that when you talk about the 27% of all fatalities in the Cayman Islands being in 2023, being from cardiovascular disease, essentially, so heart attacks and strokes, that goes hand in hand with the results of the STEP survey. So, you know, a lot of people recently mentioned that they were surprised at how many Caymanians, quote unquote, have been dying, as though it's like a mystery. And so the truth of the matter is there's really no mystery around heart disease and strokes. There are oftentimes warning signs that those diseases are coming for us years in advance of the actual event. And so I know you've only been here about 3 months, and you probably, you know, haven't quite picked up on this yet, but you eventually will. Ask Dr. Sanjeet with me when I come in. Some of us are in denial, Doc. A lot of us are in denial about our behaviors and the things that contribute to being at higher risk for strokes and heart attacks. Have you had, though, in the 3 months, have you made any observations about, you know, some of the people that you're meeting who don't recognize their lifestyle habits, diet, lack of exercise, smoking, heavy drinking, that all of these things are contributing to coronary heart disease?
Yes. In 3 months, it'll be enough to start looking there. And this also was proven in the 2021 census and in the survey from the population. You got a
Mm-hmm.
population that 11% of the population in Cayman had diabetes. Fair enough.
Mm-hmm.
But a quarter of the population in Cayman never even had measured the blood sugar. Then you could be
Oh,
having
wow.
more people with problems. 32% of the population have high cholesterol, or they are on drugs for cholesterol. But again, a third of the population have never even measured the cholesterol levels. Then it's a
Mm.
little bit of, it's a lot of no aware of all the things. People keep telling you alcohol is good for, I mean, and okay, it's a lot of studies will tell you a small amount of alcohol may or not be, that's debatable, may or not be good. But 20% of the population that drink alcohol, they drink more than 6, 7, 8 units every single time they go out for a drinking. That
Mm-hmm.
is definitely no good. And diet, 20% of the population nearly don't do enough exercise. All that
Mm-hmm.
things means that they know there are things that they can do to make this better, but somehow we are not aware enough to say, well, we have to do it ourselves. Um,
Mm.
and and there are there are some things that we cannot do anything about it. We know that cardiovascular disease you get the risk increase with age. Fair enough.
Mm-hmm.
Increase also in the first half of the life, male may have more chances to have a cardiovascular disease than women, but what they don't
Mm-hmm.
know is when they get to postmenopausal, that even up. And it's still women have the main cause of that is still cardiovascular disease. It's the
Mm-hmm.
same thing. And
Yeah.
some ethnicities, Afro-Caribbean ethnicities have more chances to have, there's more risk
Mm-hmm.
to have cardiovascular disease. It's just genetic. We cannot do anything about that, but we can do a lot about all the other things, about high cholesterol, high blood pressure, about exercise, about diet, obesity, about smoking. It's still 20% of the population,
Mm-hmm.
nearly 20% of the population smoke, and now vaping, about alcohol, all that things have a huge effect on reducing your risk for cardiovascular disease. And yeah, and
Yeah.
for a stroke, for example, reduces to up to 80 to 90% if you have a good lifestyle, reduce your risk to 80 to 90%.
Mm-hmm,
And that's,
mm-hmm.
yeah, I noticed that the people are not aware of that. They're definitely not aware of that. Um, when they come into
Yes.
the any department, yes, they are not aware. Oh, yes, they are not aware of that fact.
Mm-hmm,
Yeah.
mm-hmm. Yeah, I mean it's should be shocking all of us, but I wonder once again how much we are cognizant of these things, and that's why these sessions are really really important, because it acts as a reminder that if you don't even know your baseline numbers, we often talk about the importance of having those executive health checks, and if you're not paying attention to your numbers and you don't even know what your numbers are, you don't know because you've never had your blood sugar checked, you've never done a cholesterol check, you've never had an ECG or AKG, just as a baseline to say this is what's happening with your heart. That's one of the best ways to get ahead of this as early as possible, because there are people now who are, I mean, very sadly, last week we had a young lady who at the age of 43 had a heart attack right here in the Cayman Islands and died. She works at one of the local banks. That's such a sad story. And, I was shocked to hear that several years ago, her husband also died of a massive heart attack, just like that. And I'm thinking, my God, what are the chances that two people in the same household would both die unexpectedly of apparently a heart attack? But this is the reality that we're living with, because I'm willing to bet there are people listening right now to this program who are in their 30s and 40s, and they have never had an executive health check. Yeah. So I mean, I don't know.
This is one of the many myths there are with the heart attack and with all the cardiovascular disease. That the myth that, oh, you have to, I'm not old, because you need to be old to have a heart attack. Yes, you have more risk to have a heart attack if you're old, but a quarter, 25%, a quarter of the heart attacks happen on younger than 60. And 60 is not that old. And 20s, 30s, well, your lifestyle is no appropriate. For example, if you're
Mm-hmm.
obese in your childhood, you start clotting or clogging your arteries in the childhood.
Mm-hmm.
I've seen a heart attack in 20 years old, 30 years old, because the lifestyle or because they use, for example, drugs like cocaine or something like that, they will cause heart attacks. And sadly, I've seen very young people having full-blown heart attack in front of me. Then,
Mm-hmm.
and although it's more likely to be when you are a male or when you are older, it happens on everybody. And we can do something about it. We can change a little bit our lifestyle. It will reduce hugely the chances to have a cardiovascular problem. And more important, as you said, the more important is the warning signs. Is I've been having warning signs, is somehow what I used to run and I never have any problem. Now it costs me more to run or I have some discomfort. I go upstairs and we all get older, then when we all understand maybe more difficult, but somehow it's becoming more difficult and becoming some pressure on my chest. That are warning signs that you should be checked. Don't leave it to say, oh, it's not that bad. It's a sit down, it get better. Yeah, it does get better, but you need to check. There are warning signs. Very rarely heart attack happen without any warning signs. Very, very rarely. You've been
Mm-hmm.
warned months or years in advance that something is going on. And that's what we're trying to say here, that don't leave it for too late, just act before that.
Mm-hmm.
And
Mm-hmm.
I mean, yeah, people think, well, if I do exercise, I will never have a heart attack. Of course, if you do exercise, you will have less chances to have a heart attack. But don't feel that because you're a very fit person, you will never have any problems. There are many other reasons why you can have a heart attack. They said that before. Oh, well, I will know one day I got a heart attack because I will have this crushing chest pain in my chest. Uh,
Mm-hmm.
life was that easy. It's not like that, but it's very often it's just very gentle or very, very quiet type of symptoms. The main
Mm-hmm.
key part here is if you have any worries, just ask, just check
Mm-hmm.
yourself. And if you've been told there's nothing wrong with you or nothing to worry about, fine, there's
Mm-hmm.
nothing wrong with that. I love telling that to the patients. I love telling the patients, look, it's all right, don't worry. You don't have any problems to worry about. But I much rather say that than to say why you didn't come before. And that's the key part of all this in this condition is the time is so critical. If you
Mm-hmm.
have any symptoms that you worry about, we much rather you come to the hospital and you've been checked. That is the key
Mm-hmm.
message here. Don't leave it for later. It's too late.
Mm. Wow. Okay, folks, 936-2626. You know, if you have any questions for the good doctor, please feel free to call in. Very, very serious discussion this morning around knowing these things in terms of when you need to seek emergency care. So a heart attack happens when blood flow to the heart is blocked. And you can have, if you catch it early enough, there's some heart attacks, doc, that you can't do anything about, right? There's some, I think they're called in layman's terms, the widowmaker. When you have one of those, that's it.
Yes, but again, I don't think we should worry about that type of things. It's
Yeah.
less. We should worry about things what we can do about it. There
Yes.
are
Okay.
many risk factors. There are many things that we are is under our control. And to
Mm-hmm.
say, well, look, it's nothing I can do about it because it's going to happen to me. I got a family. That's another myth. Oh, my family. Oh,
Mm-hmm.
they all have heart attacks, and it's going to happen to me. Yes, okay, you're right. You got more risk that other person to have a problem. Even more reason to change your lifestyle. Even more reason to change what you can do about it. Even more reason
Mm-hmm.
to also when you got this discomfort, this small chest pain, or I mean, even that chest pain, as I keep saying, you can have jaw pain, you can have arm pain. Don't leave it.
Mm-hmm.
Just go to the hospital, if anything, because you think you are more at risk than somebody else. Instead to leave it and say it's going to happen to me, just
Mm-hmm.
check yourself. That's the key message. Is just there are things we cannot change. There are many things that we can change, and we can do something about it. Many things, much more than the things we cannot change.
Mm-hmm.
Yeah.
All right,
And it's
folks.
all
Yes.
yeah, it's all the assumption that and that's the key part I wanted to just set in here later on with the stroke and with sepsis is the assumption that the people think that well it's going to happen to me, there's nothing I can do about it. That is not true. That is definitely not true. It's a lot of things you can do about it, and a lot of things we can do about it. You come in on time.
Mm-hmm. Mm-hmm. All right, folks. Again, this is such an important discussion that we're having today. Do something about what you can, and obviously the things that you can't. But the things that you can't do anything about are a much smaller percentage. The truth
Yeah.
of the matter is that a lot of this is actually in our control. So some of the symptoms of a heart attack include chest pain, discomfort, shortness of breath, sweating profusely, and there are other symptoms. And I think that this is where, when we talk about those other symptoms, we should probably get into a little bit of detail as to what some of those other symptoms are.
Your symptoms could be like back pain, for example, nausea,
Mm-hmm.
feeling dizzy, all that type of symptoms that they don't really. And again, we mentioned that before. Women very often come in with these other symptoms. They come in with fatigue. They come in,
Mm-hmm.
they're tired. They come in, they are nauseous. They come in, they're dizzy. They come in, as I say, with back pain more than the full-blown chest pain or arm pain or sweating. Then there are other symptoms that may not be a heart attack. But that thing needs to be checked. If you got the symptoms, they needs to be checked. And then somebody
Mm-hmm.
needs to just check you over and they will be able to know. But don't assume, no, apologies. Don't assume that it's going to just be the full grabbing your chest type of heart attack. In fact, that is not the commonest one, by the way. The commonest one is
Mm-hmm.
the more subtle one.
Mm-hmm.
Yeah.
All
Yeah.
right.
And that's all this, yeah, that's
Yes.
all the things we can control. We can
Mm-hmm.
control every single point of that because the blood pressure could be controlled but with medication. We could cholesterol could be controlled with diet and with medication. Smoking because you can stop smoking, etc. All these
Mm-hmm.
factors reduce your risk dramatically. Not
Mm-hmm.
just a little bit, it will reduce it dramatically. And if you are in a high risk uh, population, like your family have
Mm-hmm.
history of heart attack, Okay, well, even more reason you can control. What you can control is all this, and you can
Hmm.
do it.
Yes.
How
Well,
about you?
Irvlyn says that she's doing her checks twice per year.
Okay,
Very, very good.
very
Um,
good.
please ask the doctor if he believes that statins can help avoid a heart attack. So there's lots of research and questions around how useful medication is. So let's talk about this particular one.
Statins reduce the cholesterol. Cholesterol is some of the cholesterol. We won't go into the details of that, but some of the high cholesterol is helps to clot the arteries. Then you, with time, you form this clot in the arteries, and to reduce the cholesterol, help you in reducing this clogging of the arteries. Statins definitely is proven that it will reduce cholesterol. I myself
Mm-hmm.
been on statins, and I remember 15 years ago my cholesterol was high, and then since I took it, it's been normal for the last 15 years. And statin help you on that, but not just a statin. To be fair, if you're still having a very bad diet and you keep drinking, eating a lot of fat, then that's not going to help. You need to put also change your diet too. But
Mm-hmm.
definitely, but no, definitely statins help, and the statins help you to control the cholesterol, absolutely, and will reduce the risk of
Mm-hmm.
cardiovascular disease, absolutely.
Mm-hmm. But here's the thing. 50% of people have
Mm.
heart attacks and die do not have high cholesterol. So,
It's not
you
the only
gotta,
reason.
yeah,
Exactly.
you gotta be paying attention to other things
Yeah.
as well.
Yeah.
So high
Yeah.
cholesterol, we know, has been, highlighted as one of the areas that you need to be concerned about, but it's not the only area. So here are some
Yeah.
things that put you at risk, folks. High blood pressure, high cholesterol. Normally they kind of go hand in hand though, doc. When you start to have blood pressure issues,
Yeah. Yeah.
oftentimes you have high cholesterol as well. Smoking. What is
Yeah.
the biggest issue with smoking? Because I know we've got smokers who are like, oh, it's not so bad, or I'm vaping, or whatever. What is the single biggest issue with smoking?
Yeah, and smoking, the it produces the chemicals that is going to change the layers of the arteries and the vessels and produce much more clotting. That's what happened. Imagine this is plumbing.
Uh huh.
I always trying to just have these similarities. This is plumbing. If you use very hard water, you produce
Mm-hmm.
the scales, you clot your pumps, and you reduce your pipes, and then you need to just use different types of water. You need to try to reduce something to the hard water to make it softer water. That's exactly what happened there. All these factors, smoking, cholesterol, poor diet, will help or will make this clogging in your arteries much more common, and you will have
Mm-hmm.
more risk to do that. And at the end of the day, that's what it is. It's just you increase the coagulability. You increase the chance of the body to produce more clots, and also make your arteries much more narrow and much more clogged. That is
Mm-hmm.
what it is. It's a plumbing issue. You just needs to enter. It needs to be able to clean your pipes to be able to do it. If not, it just clog. And the areas that's going to be affected more is the heart and the brain,
Mm-hmm.
because the heart and the brain are so dependent on the blood supply, and they don't have any reserve to be able to. If they don't have blood supplies in the cell will die. You can't replace it.
Mm-hmm.
You cannot replace your heart, I'm afraid.
Mm-hmm. All right, and diabetes. This is a big one
Yeah,
here because we have a lot of people in the Cayman Islands who are diabetic.
yeah.
And I have a particular, we call, our listeners students in class. And we have a particular student who loves, has a bit of a sweet tooth. And so one day he was getting some brownies from me. And I said to him, don't eat so many brownies, maybe cut back a little bit. And he said, well, I'm already diabetic and I can't catch it again. Um, it's funny, but it's also not funny because
No,
even if you have been diagnosed with diabetes, keeping it under control is really, really important because that
it's
can make
key.
a difference in terms of the quality of life that you're going to have and the onset of a lot of these complications from diabetes.
So
Yes.
diabetic is one of the population, apart from having more risk to having a cardiovascular disease, for the nature of the illness, it will mask the symptoms. It's
Yeah.
very common or fairly common or not or no uncommon diabetic patient to have what is called a silent heart attack, hardly
Mhm.
any chest pain at all. They won't even notice that they're having a heart attack. Then to
Mhm.
control the diabetes will also help you to be able to have a much more recognition of the symptoms in the future. Then yes, all the things are key part and we can control it. It's not easy. I mean,
Yeah.
it's not easy at all, but it's things we can do about it. It will reduce your risk of cardiovascular disease significantly. And
Right.
that's what we can do.
All
Yeah.
right. Big shout out to Evelyn. She says that while we're talking, she just got her squats in. We have a squat challenge in the morning. So she just did 30 squats. You're a little bit early, Evelyn, but I love it. It shows dedication and commitment, that's for sure.
I
So,
love it.
yeah, well done. And of course, that takes us nicely into the next one, which is lack of exercise.
Yes.
So,
And
yeah.
yeah, we all trying to get too lazy. I mean, again, looking the survey of 2021 survey is very interesting. You got about 17 to 20% of the population that don't do enough exercise. There is a minimal exercise that is advised by the WHO, and about nearly a quarter of the population doesn't do enough exercise every day. And that, I'm afraid, is also more common in women. Women also do less exercise in percentage. I mean,
Mhm.
that men. And that may be the type of life we live, but yeah, lack exercise is a problem for everybody. We
Right.
become too sedentary. We instead to walk and instead to just walk to the beach or to the work, we just take the car. Starting with myself, I do that run. When sometimes they walk, we cannot walk. Little things like that will really make a difference. It usually make a difference.
Mhm.
Yeah.
Okay.
But
And then poor
it's very,
diet, obviously right up there as well. You can't, I always have a saying, and, I sometimes when you're eating things, you're not supposed to be eating, you're like, oh man, I'll go walk later, whatever. You can't outrun a bad diet.
yeah, and very often with the diet, it's about not it's excess. We all
Yeah.
do something, or we all always eat something we shouldn't be eating because it's nice. It's just when that becomes your only diet, it's when we can all these snacks and everything become the only thing you ever eat. And that's the problem. The occasional thing, we all do it. We shouldn't do it, but we all
Mhm.
do it. But it's just the problem with us become your staple diet. That is what you do every single day. That is the problem that when
Mm,
you don't have that balance with the diet, there are many, many different type of diets that people can find. And to be
mhm,
fair, none of them are good or bad. It's just that balance to be able to balance and not to focus on one thing all the time, and just to have all the time having what we call the bad food. Having burgers all the time is not good. Having burgers every so often, yeah, all right. I shouldn't say that, but we all done it.
mhm,
But
mhm.
yeah,
Yeah. It's
but
the it's
yeah,
the
it
80,
does just
80-20 rule, right? Because we know that it's
yeah,
difficult for people to eat perfectly all the time and to do everything perfectly. So if 80, 85%, even 90% of your diet is where it should be, those are the cheat days where you do the little 10% in moderation.
yeah,
Yes, excessive alcohol. Now, Doc, I know this is very, very controversial, but
yeah,
more, the research is showing that physicians should be telling people not just about excessive alcohol, but alcohol at all
yeah.
when it comes to your health, because they've now, the research has shown that there
Yeah.
is no such thing as a safe amount of alcohol.
Yeah, that's very true. The latest research or the latest research lately is just mostly point in that direction. There is no safe level of alcohol. They've been the typical classical research that tells you a little bit of glass of wine every so often is not bad and it's even healthy. It's always been part of the tradition. Now it looks like it's not
It's simply not
a
true.
safe level of alcohol. But definitely what is not safe is the
Yeah.
excessive alcohol abuse. Is
Right.
the 20% of the population that drink alcohol don't just drink alcohol, they drink more than 6, 7 units every single time they drink alcohol. And that is definitely, without any doubt, without any argument, a risk
Hmm.
for cardiovascular disease. And there's no argument on that one.
Yeah.
The research shows there is probably not a safe level of alcohol, but again, people will
Right.
argue about that. But there's no argument about the other one. If you drink more than just a minimum amount, is definitely no doubt is not safe. You increase
Yeah.
your risk without any doubt.
Yeah. And I think it's taking, I don't know if physicians and others know that, while it's going to take a while for us to get people to recognize that there is no safe level. And that's why, physicians still talk about excessive alcohol. But from the second you
Indeed.
take one sip, the World Health Organization has now explicitly stated that no safe level of alcohol use exists, and risk to heart, to your health overall, starts in the first drink and increases with every dose. And so I think that, we need to get to this point where you may still do it, but you will understand that it is essentially the same thing as taking one cigarette. Like, I don't know who drinks just one cigarette, but just as an example, if you decided to smoke one cigarette, that's going to do some degree of damage to your body. Now, does it do as much as if you had 5 or 10 or 3-pack habit a day? No, obviously not, but it's still damaging your body. So no safe level of alcohol. In fact, alcohol is classified as a group 1 carcinogen. And that means that it's in the same category as tobacco and asbestos. And it has it increases your risk of several known cancers, including breast, colorectal, liver, esophageal, mouth, and throat. Even at low to moderate use, you have an increase, a noticeable increase in those particular cancers if you drink alcohol at all. So I just want people to know, I'm not trying to kill your buzz, pun intended, not trying to kill your fun times, but you should know. And cardiovascular researchers have found that what they call a J-shaped curve, where very light to moderate drinking associates with what they claim is slightly lower. Help me with this word, Doc. Is it ischemic? Is ischemic heart disease?
Ischemic heart disease. Ischemic.
Yes, then complete abstinence. But this benefit is so small and negligible, and it's actually now said that it's far outweighed by the cancer risk and other harms. So that's, I think, where drink a glass of red wine for many, many years was what was being touted as healthy for you. You could probably get the same thing from just eating the grapes or, having a grape
You're
juice.
absolutely right.
Yeah.
You're right. You're absolutely right. 100% right. Then that needs to be changed to be much more at the same as smoking. There is no one cigarette safe and 2 cigarettes is not safe. Alcohol should be not safe at all.
Yeah,
absolutely.
And remember, it has an impact on your liver because your liver has to metabolize the alcohol first. And then it sort of pushes aside other tasks that the liver is supposed to be doing. And lots of us these days are suffering from this fatty liver, Doc, which is a combination of lack of exercise and mostly your diet that is causing the liver to be fatty. So something to certainly keep in the back of your mind there, folks. Miss Sue says, I exercise at least 5 days a week, squats and Zumba to music. Good for you. Keep moving.
Go for it. Yes, exactly.
Yes, I love it. Evelyn says she loves her wine, but she gets a headache from drinking it.
In that case, don't drink it.
Yes. You have to abstain. Heart attack myths. So let's get into this now. Pain equals pain. Yeah,
pain, because people associate heart attack to this severe pain. Oh, I cannot be having a heart attack because it's just really discomfort. It must be a heart attack. I've seen on the telly is somebody just clenching the chest and falling on the floor. That is not the case. Many of the cases we see, the pain is just there or not at all. Then that is a myth. Don't wait for very often you won't have it, this very severe crushing chest pain, because that is not what always happen. Being old, yes, we said the older you get, your risk increased. But doesn't mean you have to be old to have a heart attack. In fact, a quarter of all the heart attack happen in younger people. Then don't assume that because you cannot have a heart attack. That is not true. The same with men. Men have more chances or more risk to have a heart attack in the first half of their life. Absolutely right, compared to women. but this
Mhm.
even up very quickly, and also related to the lifestyle. The lifestyle of the woman is also not very good diet, not very good exercise. Your risk increases too. But
Mhm.
after menopause, it's exactly more or less the same,
Right.
and it still is the first cause of death in women is cardiovascular disease. It's still the
Yeah.
same,
Yeah.
much more than cancer or anything else. It's still the same. And
Mhm.
and as I said, women may have a slightly different symptoms. Maybe more about feeling tired, maybe more about feeling dizzy, maybe more about feeling not very well, more than just the
Mhm.
typical chest pain. That happens in
Mhm.
women much more often than in men.
Yes.
You know?
Huh.
Yeah,
And
to
so
believe that.
little,
Yes, yeah,
I was just going
go
to say
for it.
the little protection that we get from the hormonal protection that we get, we
It
lose.
disappears.
Yeah. Wow.
Yeah,
That's
it
it.
disappears and even up. But as I say, it's also with the lifestyle, just because you're a woman, but your lifestyle is with a lot of obesity, no exercise, high cholesterol, etc. You're going to be having the same risk that a man. It's not just because you're a woman, you're not protected just purely for that.
Mhm.
Again, being fit, be fit. What the people are writing and in the chat is fantastic. They're trying to keep fit. That is fantastic. It's going to reduce your cardiovascular risk, but you're not immune. You still
Mhm.
can have a heart attack. If you got symptoms, go back to the same thing. You need to ask for help and you need to be checked. Just because
Mhm.
you are very fit doesn't mean you don't want to have a heart attack there. The other
Mhm.
thing is that people say, I cannot have a heart attack because I've seen it, and it's like somebody having a cardio arrest. Cardio arrest is not the same as a heart attack. A heart attack is, go back to my analogy, it's a plumbing issue, it's a clot in your pipes. A cardio arrest is more an electrical issue. It's an electrical malfunction in your pump. Your heart is still working. And
Mhm.
a heart attack could cause the cardio arrest, but it's not the same. You don't need to have a cardio arrest to have a heart attack. That is
Mhm.
usually it's too late. Or
Mhm.
what we said before, family. Oh, all my family have problems with the heart, and it's
Mhm.
going to happen to me, isn't it? Yes, you got more risk, but you could do something about it. You could
Mhm.
change your lifestyle and reduce the risk dramatically, not just a little bit. You will reduce it
Yeah.
dramatically. Yeah,
Wow.
and the last one that the people also think is sudden. Oh, what is the point to worry? It's going to happen one day and it's going to be very sudden. They are always, well, not always, but 99% of the time, warning signs. He's been telling
Mhm.
you something is wrong for months. You've been
Mhm.
you've been having warning signs that you've been ignoring. That is the what we're trying to say with this. When you got the warning sign, don't leave it for later. That's the
Mhm.
time to be checked. And okay, to be told there's nothing wrong with you. I much rather tell the people, tell the patients there's nothing wrong with you than to say, yes, you're waiting for too long. And
Mhm.
these are all myths. They are very common myths that people believe in all this.
Mhm. Hmm.
Yeah.
Wow. Some good ones here today. 936 2626. We're going to start wrapping up here in just a little bit. But if you have a question that you would like to ask the good doctor, by all means, please check in. Sue says a lot of people don't check the blood pressure, cholesterol, eat the right food, exercise. A lot of the Cayman foods is full of fat in it, and you
Yeah.
don't even have to be overweight. You can be skinny and still have a heart attack. Yes, Sandy, they need to get checked. So there's this whole thing. I think it's called skinny fat or something where basically on the outside you look pretty good, but on the inside you've got fatty liver, you've got other symptoms. So
Yeah.
that's why knowing getting your executive health checks is a good way to know your numbers, right? Because there are people who walk around with silent killers or people who have high blood pressure and they have no idea, and they're
Yeah.
not overweight. We wouldn't say that they're necessarily obese, but there are still some risk factors there. So get it checked out, at least know your baseline numbers, and that undoubtedly will help you to, continue to make better decisions. Some people just genetically are not prone to put on weight, doc, but they can eat anything they want and they think that that's okay. Still, you've got to monitor your dietary intake because it has an impact. Like I've got a sweet tooth, and now we know that sugar is an addiction, and it's horrible for you.
I
Um,
know. I know.
yeah, because I mean, it might be worse than fat in your diet, really. And
Yeah.
things like dementia, all early onset Alzheimer's, stroke, all diabetes, all of these things have a link to taking it in too much sugar. Now, let's talk a little bit about a stroke, which is considered a brain attack. So this is what happens when you have blood flow in the brain that is interrupted. It's a blood vessel that's either blocked or bursts. And this is something that impacts a lot of people in Cayman as well.
Yes. I mean, yes, we can go through all these very quickly, but it's very, yes. I just said nearly 1% of the population have a stroke in the census of 2021. It's a very common thing. And a stroke and heart attack is all part of the cardiovascular disease. It's all the same, nearly the same mechanism. And although the stroke could happen because a burst vessel, that's only about 17% of the time. 87% of the time is a clot. It's the same that the heart is because your arteries are blocked. Then that is becoming ischemic, and that is the key part. Because go back to the time critical. We are lucky enough now that we are able to treat people that having a stroke in that small, very narrow window time of the first few hours. If the problem is because you got a block in the arteries, we can unblock it. We can give you some drugs to try to dissolve the clot, or we can also put the wire and do what is called a thrombectomy. We can just unblock the artery and restore the circulation to the brain. If you leave it for too long, the brain's cells will die. That can never recover. And that is so key part as well. All these three things we're talking, stroke, heart attack, and in a moment, very quickly, sepsis, are things that the hospitals are ready for it. When we got somebody who's coming with a stroke, you will have a team ready for you in the hospital. You will have a team that is going to diagnose, is going to start treatment, and it's going to take you very quickly to the lab to be able to unblock it. And the same with the heart, and the same with sepsis. Then these are emergencies that we are very aware that is time related. Then that's the reason why, if you put the next slide, is key. It's about recognizing the be fast. This is key. Be fast is B is for balance. If somebody is having problem with the balance, it's uncoordinated. It cannot. In E for eyes, it's not just about being short-sighted. It's about just suddenly not able to see properly. It's just seeing double. F is for face. Your face feels funny, maybe even asymmetrical. You feel weak. Your arms are in the legs too, but they aren't mostly. One is weaker than the other. S is for the speech. The speech gets slurred, slow, different words. If you got any of these symptoms, T is the part. It's time. You are time critical. You need to call 911 or ask somebody, know yourself, to drive you to the hospital now. Because you may be having a brain attack, no heart attack, a brain attack. And so time critical. If you are coming to the hospital in that window of time, we can treat you. We can reduce the problems you're going to have with having a very life-threatening condition like a stroke. That is so key that you got any symptoms like this, come to the hospital. It's much better to be told this is nothing to do with a stroke than to be told, as I keep saying, it's too late. Then this be fast is key. Everybody needs to know that. If you got any of these symptoms, don't hesitate, don't delay, come to the hospital now.
Wow. Okay.
Because, the sooner you get to the hospital, the sooner you can receive life-saving treatment. We're lucky enough in Cayman, we can provide that treatment. We can provide that life-saving treatment for the stroke in our hospitals. Then just come now. Don't leave it for later. Is key. The risk factors is exactly the same as the heart. Exactly the same. It's all about arteries. It's the same. It's the same factors. You can reduce your risk factor for a stroke up to 80-90%, changing all these things.
Wow.
And there are also a lot of myths about strokes. Only happen in old people. Well, it doesn't. About a quarter of them happen in much younger people. Nothing can be done to prevent it. Well, we already said it's a lot of things you can do to prevent it, because you can reduce up to 80% your chances to have a stroke if you change all that factors that you can change it. There is no
Mhm.
treatment. There is treatment. In a
Mhm.
very narrow window at the very beginning, we
Mhm.
can help it, we can treat it. For later, yes, it's not treatment, or not treatment to stop it, it's treatment to reduce the symptoms. But at the beginning, there
Right.
is treatment.
Yes. Wow.
One thing is about TIA, where it's called mini stroke.
Mhm.
If somebody have a mini stroke, is to have the symptom for the stroke that somehow it gets better a little bit later. And then people thinking, well, that's all right. It wasn't serious. It got better.
Mm.
Again, that's a warning sign. If you got a mini
Mhm.
stroke, it's telling you you need to go and be checked, because today's a mini stroke, tomorrow could be a full stroke.
Mm.
Then be very careful. Take people taking aspirin, which is a very good thing to do, but be very careful. 13 to 15% of the strokes are burst arteries. If you take an aspirin, you get to make it worse. Then
Mhm.
don't assume because you're taking an aspirin, you're going to be fine. The other things are being obvious and dramatic. Well, very often could be about feeling dizzy, not able to, oh, I feel a little bit dizzy today. I just been not coordinating properly. It's not going to be somebody collapsing. In fact, most of the strokes don't collapse, don't faint. Most of the strokes have
Mhm.
other symptoms.
Right.
Then all that things, all that myth, it's very much like the heart problems. They're all myth. You can do a lot of things about it, but you have to don't delay treatment, don't delay to be checked. It's so
Mhm.
important on the stroke. It's so key that you need to come to the hospital very quickly.
Mhm. Hmm.
Yeah,
Very good.
yeah,
Wow.
yeah.
Fantastic. Greg says, how can you tell if you've had a mini stroke?
You will have very similar symptoms. You will have all the symptoms we had before about coordination. You will have feeling a little bit dizzy. You may have even weakness, but somehow it doesn't stay. It gets better. Oh, now I'm all right. Oh, okay,
Mhm.
it got better. By
Mhm.
definition, the TIA is temporary. If the symptoms get better in the first 24 hours, it's called a mini stroke. But very
Mhm.
often only get better in minutes. Oh, it's all right. It wasn't a stroke because it got better. That's what a mini stroke is, a TIA. But it's a warning sign. It's like having chest pains when it just get better. It's a
Mhm.
warning sign that you somehow, it may not be fine. Your arteries are not patent enough, and it may be just that close to be clogged completely. Then that's what it. That you can tell them in stroke having the same symptom of stroke, but don't assume that it get better very quickly. It's not a stroke. That is
Mhm.
the main message. TIA, it's mini stroke, is as dangerous if it left alone as a stroke.
Mhm.
That's the main thing.
Okay.
Yeah.
So,
The next,
yes. Mhm.
yeah, the next one is the sepsis. The sepsis is probably one of the most important one, because the people don't understand it. Even doctors sometimes don't understand sepsis.
Mhm.
Yeah. The next one we're going to see in a moment.
Okay. Let's talk about
Yeah.
sepsis.
Yeah.
A lot of people
Sepsis is
don't really
called.
know what this is even.
Exactly. Sepsis is very well known as the silent killer. I mean, I remember, I'm old enough to remember 15, 20 years ago, there were a lot of awareness about sepsis, because a lot of people were dying for sepsis because they were not recognized by medical professionals. There had been a lot of training, a lot of awareness about how sepsis is. And now we behave like in this with a stroke, or with the heart attack. When we see something, we act very, very quickly. Sepsis effectively is that the body overreacts to an infection. The immune system overreacts. Instead to just protecting the body, is effectively overreacting and is damaging the organs. Then
Mhm.
it's not the infection itself. It's not because it's a bad infection. It's because the body is overreacting to the infection. That's the reason why even sometimes a simple infection, a water infection, could cause sepsis. Then
Mhm.
it's not completely being a bad infection. It's just the body overreacting, and that is the problem, because most of the infections they are normal, they will never become a septic. Then
Mhm.
that fine line between, are you having now any normal infection is going to get better, or no, it's becoming septic, is very difficult sometimes to recognize. Then suddenly you got an infection that you're becoming more confused. You started
Mhm.
breathing faster. You started not passing any no pee, no passing any urine, feeling very unwell, having changes on your skin, become very mottled. That is the time you need to say, look, this is not just a normal infection. Things are getting worse than I thought. What I was told it was going to get better is not getting better. I need to go to the hospital to be treated or to be checked. And again, it's so time critical. Very often in the hospitals, we are trained to do that. We will start your treatment before we even recognize that you what type of infection you got. Uh, things sepsis are fast. This is from Australia. There are plenty of awareness campaigns in many countries for the people to think, for professionals and also for the patient to think. If you think somebody, just think about sepsis. Think about sepsis and then act. We
Right.
will act. Is somebody coming with all the symptoms that we think is septic, even if we haven't diagnosed it yet, we will start treating. We won't
Yeah.
delay treatment.
Yeah.
We'll start now, because if we delay, it's too late.
Uh-huh. Wow.
And but is that recognition is that with sepsis is about, and that's the reason why I tell also all my doctors, it's so important to tell our patients what to expect. We give you a roadmap. When you come into the hospital with a normal infection, we tell you what to expect. They say, well, this is going to take X number of days. This is going to be getting worse, getting better. It's going to be fatigue. You're going to have all these symptoms that is going to last for X number of time. Is somehow what you've been told is not always happening. Things are not really developing in the right direction. It's getting worse. Yeah, this is not right. That is when you need to come to the hospital. Don't leave it for too late. It's much better to come back and say, look, I know you told me that I won't be all right for quite a few days, but I'm not happy. This is not getting any better. And in fact, very often I tell the patient that you're coming back, just tell, could it be sepsis? Put that word into the doctors or the nurses' vocabulary, because immediately they will think themselves to, oh, okay, let me have a look. We'll have a look. Because sepsis is one of the things that you need to act very quickly. And we got in the hospital something called sepsis 6, that if we got somebody that is coming with query sepsis, we won't even wait. We'll start giving antibiotics, we'll start giving fluid, we'll start giving oxygen, we'll start giving all the medication they need before even proving the code. Because we cannot wait for that. And one thing they asked me yes.
I think that's how quickly it moves and how deadly it can be, right?
Yes. And I've seen it so many times. I mean, people think it's very rare, but it's not that rare. One thing they ask me quite a lot, and it's a very good question, is about, okay, if that's the case, why we don't give antibiotics to everybody having an infection, then everybody will be fine. The problem is not as simple as that. If we treat every single normal infection, the vast majority of infections don't become sepsis. The vast majority of infections don't need antibiotics because they're not even anything related to bacteria. They are, for example, viral. The antibiotics won't work. If we give antibiotics to everybody for a minimal infection, the problem is bacteria are very, very clever type of organisms. They will become accustomed to the antibiotics, and then they won't work by the time you really need it when you got sepsis. And we got plenty of antibiotics now that don't work because they got a lot of resistance to the antibiotics. Then if we give antibiotics to everybody, in fact, we are not making anything better. We're making things worse. Then the way to prevent sepsis is not to give everybody antibiotics when they have a little cold, is to identify, is to check that things are being monitored, check that things are not getting better. Things are things that is supposed to be, I was told that in a week I was going to be much better now, but somehow I'm getting worse. And somehow the fever is not getting, I'm getting more shivering, I'm getting more cold. That is what needs to be checked. And that's what we need to check instead to just treat it for everybody. The other way to prevent, obviously, sepsis is to vaccinations. Meningitis has been an outbreak of meningitis in the southeast in the UK in the last I think it was 2 weeks ago, the last week, with 2 people die. Vaccination against meningitis is one of the reasons why meningitis is a little bit less or much less common than it used to be before. Then all that things are what is going to be done to prevent. But sepsis is really much more than the other one, because the people very often don't even know what it is. They think it's just a bad infection. It's not a bad infection. It's something different. It's just the body not reacting properly to that infection. And it could happen to anybody. And it's really an emergency. It's really, you have to treat it very, very fast. If you talk to any professionals, with most of the professionals and medical professionals, we always much more worry about things like sepsis because they tend to be much more quiet, they tend to be much more difficult to treat, and it's really people will become very, very, very sick when they become in this stage, in the later stages, very, very sick. And
Mm,
sepsis is something that we need to be all very aware
mhm,
that we need to go to the hospital for that.
mm.
Yeah. And again, there are quite a few myths about sepsis. I mean, one of the typical one is that only happened again old people. Only old people have sepsis.
Mhm,
And again, it's not true. I mean, it
mhm,
happened to very young people. Children have sepsis, much also much more common. Um, you can have patients there under, for example, for cancer treatment.
mhm,
The immune system has been changed because the type of treatment they get, they are more common to have, or they are more frequent to have sepsis than somebody else. And
mhm,
it only just don't only happen in adults.
mhm.
Yeah, if you
And
suspect sepsis,
can I also say that I think there's one of the big myths is that it only happens in hospitals, that you only
yes,
catch it in,
yes.
I mean, a hospital can be a high risk environment, but there is also the potential that you could get this at home.
Well, yes, sepsis happen in the hospitals because they are in the hospitals, and one of the reasons we don't want the people to stay in the hospital for too long is because it's a place where you got plenty of people with illness, and you don't want to catch anything. But at the same time, the vast majority of the sepsis start at home, they start in the community. The vast majority of them coming from home with the symptoms of sepsis, and they stay in the hospital. The vast majority are not the hospital sepsis; they are from the community. The vast
Hmm.
majority of them. Yeah, that is a big, big, big myth, and it's not as rare as the people think. People think sepsis is very rare. I mean, if you work in a yeah, that's what I was saying before about sepsis 6. These are we are trained already to recognize sepsis and act very quickly. We
Hmm.
do not wait. We start treating. We do not wait
Hmm.
for that. And as I was saying,
Yes.
uh, people think people working in emergency departments and normal visit the emergency departments, it's nearly a
Hmm.
daily occurrence to see somebody with sepsis. It's very common. And
Right.
I don't want to scare people because it's not about scaring people, it's about awareness. But in the States, and I know this is nearly 350 million people in the States, but one
Hmm.
person died from sepsis every 2 minutes in the States.
Wow.
Sepsis is, yeah, it's about 350,000 people die.
Oh
It's
my
a
God.
very, very, very common. It's what is in the top 4 or 5 of the cause of death in the States and well in the Western world is very common and needs to
Mm.
be. But because we don't, but the main
I,
reason is because we don't
yeah,
recognize it.
I'm
We always too
shocked.
late.
I had no idea about that.
Yes, yes. It's a very common thing that we don't recognize. And we
Wow.
always think it's because oh, it's the infection, it's very bad infection, it's the false. You can have a normal water infection or a normal infection, and somehow in that particular person at that particular time,
Mhm,
the body behaves differently, and your
mhm,
immune system go into overdrive, and it
mhm,
completely causes sepsis. It's the infection itself is the trigger, and if you
mhm,
treat the infection, obviously you will stop the sepsis. But the sepsis is not because the infection is very bad; it's because the body is overreacting to that
mhm,
infection. And that's the part that is key here. Is not just any infection could cause sepsis. Some infections are more common, but any infection could cause sepsis. Any.
mhm. Hmm.
Yes. I
Wow.
know.
I'm learning
Yes,
so much.
and it's not about scaring people. It's about do
Yeah.
not. It's not. It's about if you have any worries, check and not
Yeah.
just Google. Because if you Google things, if you
Mhm,
Google things, will come out with 20 million things. How to prevent it? You got it there. Early monitoring is not about giving antibiotics to everybody. It's about monitoring your symptoms. Oh,
yeah.
it's behaving normally. I'm getting better. That is not sepsis. That's an infection that's getting better. But somehow it's getting worse. If you
Uh-huh.
got all your vaccinations and you stop the infection, yeah, you will stop the sepsis. Wound care is so key. We, uh, I mean, I have a experience in that in my own family. My aunt, 15 years ago, died from sepsis for an infection in the buttock. The infection was normal; it wasn't too bad, but it wasn't cared properly. And 2 weeks later, she was dead. Then then it could happen to anybody. And she was a very healthy person. She was extremely healthy, but somehow the care of the wound wasn't very good. She wasn't given very good care for the wound, and that caused the infection to spread. Then all that little things was going to prevent sepsis. Once you got the sepsis, the reason the infection is that the bad infection doesn't cause the sepsis, but if your infection is not controlled, you got more chances to have a sepsis there.
Mm-hmm.
It's one of it's called the silent killer for a reason. It's because the people don't recognize it, and this is what happened. And this is the myth. Only as you said, only happened in the hospital, but it's not true. Only in elderly people is not true. If you are healthy, you are safe. If you are healthy, it's much more likely you will not catch infections. That's very true. But if your infection is not behaving the right way, it's getting worse, don't be assumed because you're healthy, you're going to fight it. Just check. It's not just without infection. You can have sepsis for any type of infection. As I say, it's not rare. It's fairly common. It's obvious? No. If it was obvious, it's not obvious sometimes. Sometimes it's very insidious. Sometimes it just happen and it just needs to say, well, it's something wrong. It's just not behaving properly there. Cannot be prevented. It can be prevented. We just stay in there. It can be prevented by reducing the number of infections there. And be careful because the post sepsis syndrome gets better, then it's safe. You could have a lot of problems after the sepsis is treated. Then just don't assume because you get better, everything is fine. Your body may require a lot of.
Uh-oh. We lost the doc there. Seems like his stream kind of dropped out. But I'm learning so much here about sepsis because I honestly did not know. Wow. Okay, there we go, Doc. Looks like your internet kind of dropped
up. Yeah, I mean, we're nearly finished there. But the main thing with the last these three conditions we've chosen is they're all time critical.
Yeah.
It's so important to think that we gave you a roadmap, we gave you how things are going to improve, how things are going to get better. If it doesn't, if it's getting worse, if you're not happy, I'm not being right, just go and be checked. Be reassured. I repeated that 20 million times because I said that to every single patient. They tell me, oh, sorry, I didn't want to bother you today. I'm sorry, I wasted your time. You never, ever, ever waste anybody's time because I'm the happiest person in the world to tell somebody, so look, it's fine. It's not sepsis. You don't have a heart attack. You just having, I don't know, muscular pain. I don't mind anything. I much rather tell you that they just have to deal with the consequences of, oh my God, why didn't it come before? I got cases in my head when I said these words that I can just pass through my head. People that say, why didn't it come before? Why? And much is the main message from today is that if you got symptoms that are not really sure what is going on, check it. Don't leave it. Don't assume that you are, oh, it cannot happen to me. Well, it could happen to anybody.
All right, folks. And of course, the good doctor is here telling us about these very, very important emergency and life-threatening situations. And, the practical takeaways, as he indicated, is don't wait for symptoms to pass if they're unusual, concerning. It's better to be safe than sorry, quite frankly. Avoid self-diagnosing or delaying care and seek urgent medical attention when in doubt. Early action leads to better outcomes. And we have a few questions inspiring. You can probably rewind and get this one answered. But one common mistake people make with strokes is, again, trying to wait it out to see is this going to be okay? Yep. That's not the thing to do at all. Vision 1993 says, my mother died from sepsis. She was in so much pain because of the infection. Wow. And I just had someone else message on WhatsApp saying that they're a survivor of a sepsis infection as well. And they're saying, again, thank you for awareness on this topic. So much more common than I ever knew, Doc. So thank you so much. Yeah, thank you so much for highlighting this.
As I said, it's not just only about the bad infection. Any infection could cause sepsis.
Yeah.
When it doesn't behave properly is when you have to come to the hospital.
Mhm.
That is the thing.
Yeah.
But don't assume that this infection is nothing to worry about. Any
Yeah.
infections potentially could cause sepsis.
Yeah. Yeah. All right. Thank you so much. Really, really
Thank
appreciate it.
you.
Big shout out to Strong Will. We got a little story that we'll share, but we'll let Dr. Andres go. He's busy and he's got patients to see, no doubt. So
I will.
appreciate you coming on the program.
Thank you very much. It's been a pleasure like always. Thank you very, very much.
Thank you so much. All right, folks. Strong Will says, Sandy, a friend of mine was having pain in the chest last week and he thought it was gas pain. He went to HSA and they sent him to Health City. He had blockage in the heart. He did open heart surgery and the surgery was successful. Thank God he caught it in time and thank God for the good doctors at Health City. Wow. Yeah. I mean, and thank God he was referred because, sometimes doctors have to recognize, yep, this is outside of our area of expertise or, we don't want to touch it for whatever reason. And as long as they get you there in sufficient time, certainly. But time is of the essence this morning here, folks. The takeaway is time is critical when you're having certain symptoms. And I must tell you, the sepsis one was very, very educational for me because I never thought that sepsis could be classified as life-threatening, like you need to get to the doctor right now sort of thing. So, fever or abnormally low temperatures, confusion or altered behavior. So these are some of the symptoms. Rapid breathing or heart rate. Patient appears generally unwell. So sometimes the symptoms can be very vague and non-specific, and you can mistaken it quite easily for minor infection. But, get into urgent care and urgent medical evaluation is required. Early treatment significantly improves outcomes. And I've known of people, unfortunately, who have died from a sepsis infection. And by the time that the physicians realized what it was already too late. Good morning, caller. Oh, yes, ma'am. Good morning.
Morning, Miss Sandy.
Morning, honey. How are you?
Not bad at all. Just have a little flu here suffering from. I want to shift up the table for a little bit. Guess what? I discovered, so I moved to the UK and in December of last year, I was showing signs of a stroke. So the side of my face droop. I wasn't able to talk out of my mouth properly. My left eye went blurry and I sat down and I felt my whole entire left side of my body go dead.
Wow.
Arms, leg, everything. I was then rushed to the hospital by an ambulance. And when I went there and they did MRI, CAT scan and everything, this is the first in my life I'm hearing it, but I wanted to share it on your show.
Yeah.
I was suffering from FND. Never in my life I've heard that.
Okay. What is that?
Functional neurological disorder.
Okay.
So there was no stroke. There was no signs of no stroke on the brain. It wasn't a stroke. There was nothing of a stroke being done to the brain or the body in any way, which was a good thing, the doctor said. But that is a new one for me, and that's also very frightening. It comes on with signs of a stroke, but it's actual functional neurological disorder, FND. First in my life I've ever heard it, Miss Sandy, and I thought I'd just throw it out there with you because I thought I was having a stroke too.
Wow.
Heart rates went up, everything. I honestly, Miss Sandy, like I was trying to talk, I couldn't talk. At that point, all I could do was just cry because I couldn't respond. I only had my right hand and I can only, do thumbs up or thumbs down. But the left side of the body, everything went dead, completely dead. And I was happy that I was in a clinic with people that, rushed to my attention. It was a bit of wait for the ambulance. But then when I got to the hospital and they did what they were doing, eventually after a few hours, then I feel like tingling in the legs and stuff. And then there was this, like a gush of hotness. And then I start to feel like I can move my toes and my fingers and hands and stuff again. But I wanted to share that with you. Yes, Mom.
Wow. Thank you so much.
You're
I mean,
welcome.
there are literally so many things that can happen to the human body. Some of them we've never even heard of before, but it's good to know when something is going on. And I think the takeaway from today is sometimes, don't wait it out. You don't quite know, what's going to happen, but it's best to present to the emergency, the ER or casualty, because they are skilled hopefully to find exactly what is happening with you. So yeah, pretty wild. Oh my gosh. Well, I'm glad that you're okay. Because all of those symptoms that she mentioned, I got to be honest, if someone said all those things to me, I would have said, oh, they're definitely presenting with a stroke. But it was something else that we've never heard of before. Wow. Okay. All right, folks, good segment today for sure. Ms. Pat said, thanks for such great public education and awareness. And we also have a comment that I saw earlier about health insurance. So Luis is talking about, he says it's useless. When you visit Health City, your health insurance is depleted quickly. When your insurance is depleted, Health City cannot provide any further assistance. Better health insurance should be available for everyone and affordable so that people can go to the doctors. I've heard many people saying that 2 visits and their insurance is depleted. Just a consultation alone is around $300. Blood testing, depending on what, could cost around $600 or $700. So stop talking crap. Well, I think, Luis, if anyone is talking crap here this morning, it might actually be you, because you're conflating a few different issues. Number one, your quality of health insurance has nothing to do with Health City. That's a matter for you and your employer. And I get that health insurance in this country specifically is actually quite expensive. A couple weeks ago, we had Miss Aniki Brown on the program, who has had umpteenth years of experience as a country manager for formerly Generali. They're no longer existent here in the Cayman Islands, but she knows the ins and outs of the health insurance industry quite well. And there's no doubt that if you have the SHIC plan, many people call it something else that begins with S, you fill in the blank, okay? And also is a 4-letter word. So that plan leaves a lot of gaps. And the discussion at that time came up after a lady here had, health insurance with Cayman First. And unfortunately, it was obvious that there were a lot of gaps in her policy. She needed, was it kidney, liver transplant? Well, I can't remember which one now, to be honest, but I think it was liver. And yeah, it was a problem. There was a lot of things, unfortunately, that worked against her, and she eventually passed away. But when time is of the essence, if you're having to fight with your insurance company to even get them to approve emergency care, to get something approved, then that's a problem. But you don't need to be, Luis, blaming Health City for that. That's not a Health City problem. That is a problem with health insurance in this country. And maybe what you need to talk to, who you need to talk to, are the representatives who are setting the legislation, the health minister and others who are setting the legislation in terms of what these plans can and cannot cover. In case you don't know, there is a list of, I forget what the technical term is. Aniki, are you listening this morning that you can help me? Let me see if I can get a hold of her. But basically, the medical health professionals have an accepted list of charges that they can charge. And so they can't charge above that. And here's the crazy part. Where's Aniki? Where is Aniki, honey child? Here's the crazy part is that this, let me see if I can get her to tell me. Somebody, I know there's got to be a doctor listening this morning who can assist me with this term, but this list of charges hasn't changed in over 20 years. So you're complaining that, the hospitals and the doctors are charging too much. That approved list was approved over 20 years ago, and that has not changed, and that is what it is, the standard fee schedule. Thank you, Kev. Thank you so much. And yeah, that standard fee schedule, they can't go above that. So come again. You know what I'm saying? It's not like they're sitting here just deciding to charge you exorbitant fees. And in fact, the truth of the matter is, by most accounts, Health City's pricing is either extremely competitive or in a lot of instances cheaper than what you're going to get it done at other facilities on island. That's why people come from overseas to get procedures done here at Health City. Good morning, caller.
Morning. I was just about to call and say I think they refer to it as reasonable and customary charges.
Mm-hmm.
And those prices are set by the Health Insurance Commission, if I'm not mistaken.
Mm-hmm.
And correct, those standard, reasonable, and customary charges haven't been increased in a while.
Exactly. It's like over 20 years. And I mean, I have physicians talking to me like, Sandy, everything. Tell me one thing that has not gone up in the last 20 years.
Exactly.
All of the cost of living has gone up. And so
but the problem is, if the doctors' fees are going up, and this is why it hasn't changed, because if the doctors' fees are going up, then the health insurance coverage needs to go up as well.
Right.
Does that make sense?
Yes, because
right?
they go hand in hand.
Like if you normally, exactly, because if you normally get, say, $500 a year for dental, but then your dental, the charges are going up, then you need your dental needs to go up to $700 or whatever, you know?
Yep. Yeah.
So they don't want to mess with all that. So that's why they're not.
Exactly.
But it has to change.
It's and listen, someone just mentioned, they said, Sandy, it's not just in this country, like health insurance and access to good health care
everywhere
is something worldwide that people tend to struggle with. In the US, I was reading something.
Think we're better off than most. Doing a good job. Yes. Yes.
Absolutely.
All right, thank you.
Thank you, my dear. I appreciate it. But yeah, I can tell you for a fact. Okay, let me just do one quick thing here. We have a vehicle that's blocking access to one of the buildings in town. Straight up jackass of the day. You don't park like that. Come on, folks. We shouldn't have to be telling you just to have common courtesy with public access and entry into building. But yeah, so listen, pay attention now, Luis, because the sad thing is, and here is the health services fees and charges, and you can have access to this document if you wish. And it will tell you, I don't know if we can enlarge it, but it can tell you exactly what the fees are. You see where it starts there at page 5, waiver fees, failed appointments. So here you go, right? So if you go in and you're having major surgery, surgical fees, minor inpatient physician fees, these things are set individual itemized fees. So there is an actual list here, and this list has not been updated. Let me get a little bit closer with my specs here. 2008. That was the last time that it was revised. How long ago was that? What year are we in now, honey child? Hold on. That is 1 second. You putting on my math brain. Y'all know by nature, I'm not really a math person. So that's some 18 years. The fees have not been adjusted. Like I said, I challenge you to show me anything else in 18 years that hasn't been adjusted. The cost of living is going up. Everything is going up. And yet physicians, I think some of y'all believe that they're rolling in it. Again, you don't know the cost of equipment and the cost of doing business as a physician, but they have to stick to this fee schedule here. So, and I was reading over the weekend that Americans were saying how they, the things that they cannot afford anymore. Well, there's a lot, apparently. They can't afford to get new vehicles, and they can't afford good health care. They can't afford mortgages and housing. And so some of these things are worldwide issues. And I get that you're frustrated. I see your message here that says, sorry, Sandy, for my frustration, but it's so frustrating to see people suffering and can't do anything. Many people are suffering. I understand that, but you have to be careful when you try to put the blame on an institution, because that's just not fair when it really has nothing to do with them. I think what happens at other institutions, for example, the HSA, a lot of people who go there actually have coverage with Cineco. So they don't see the bill. So they're not really recognizing. But, Cineco has limits and stuff too. And you can run out of your coverage with Cineco. Good morning, caller.
Morning. So one more thing that I wanted to add, and I could be wrong, so if someone wants to correct me, but I think the physicians are allowed to charge more than the standard fee,
Yes.
but they can only get reimbursed from insurance companies according to the standard fee.
That's right. So YouTuber clarifies that says they can charge above if they're private.
Right.
Yeah.
Right. I think HSA can charge above as well. As a matter of fact, I think they do charge above for some of the things. But then what happens is the individual is responsible then, and their co-payment is a lot higher. And a lot of times it's harder for the physicians to recoup that money from the individuals versus the insurance companies.
Yeah. Absolutely.
So really and truly, the insurance companies are the ones who are winning in all of this.
Yeah. And this is why, I mean, going back to the points this morning, and every single week we're on here talking with Health City, we know that a lot of our issues are preventable, right? So this is where now as individuals, we need to take better charge of our health. Like if you know that health insurance, health issues, it's taking a toll on the entire community because you look at that STEP program and you see how horrible a job we're doing at managing our health care, right? Which means that we ourselves are not taking charge of our health and well-being. And that is something that every single one of us has the ability to do. We can do that. We could all lose weight. We could all exercise more. We could all eat a healthier diet. We could cut out the smoking and the drinking.
And a lot of people don't even realize that their health insurance covers has a preventative or what else do they refer to it as? A wellness benefit.
Yeah. Although in other words, I don't think they're good enough personally, but anyway, those need to be increased a little bit.
It's not a lot, but at least, you can go in, you can get your teeth clean.
Yes.
You can get these things so you can prevent from cavities and, it's something. But a lot of people don't even know that they have that on their insurance.
That's true. Very true. Thank you, my dear.
Thank you, Honey Jill.
Yes, Honey Jill. We got so much to talk about today. We're going to definitely go into a little bit of overtime. Good morning, caller. Uh-oh. I can't hear you now. Hold on. Let me see. Is that any better? Let me know if you guys can hear the caller, by the way. Hello? Oh God, I can't hear you. Let me change one more thing. I'm having some audio issues. I know some of you mentioned it earlier. Hello? I'm here. Nope, I still can't hear her. Can you guys hear her at all? Because I cannot hear her. Can you just call on the regular line? I think if you called on the show line, because you're calling on the personal number, but maybe call the show number and hello? I think I could hear it towards the end. But yeah, call the show number 936-2626. Because if you're calling my personal number, I have to take it through WhatsApp on the computer, and I don't know. I wasn't hearing none of that. Yeah. 936-2626 is the show number. Any idea what's up with the crazy traffic out of West Bay on the Esterly Tibbetts this morning? Ooh, I don't know. Does anybody know? A Band-Aid is $10. An ankle brace costs $100. Way more than you buy at the pharmacy. Okay. Good morning, caller.
Is that better?
Yes, I can hear you loud and clear.
Sorry about that. I think it might have also been my mic, but I know you've been having some trouble.
Yeah, it's adjusting, trying to figure out which exact setting. No, someone was talking about their frustration at fees that they say, like people are running out of insurance at Health City as though that's Health City's fault. But we were talking about the standard fees and then how people, so the standard health insurance fees. So we touched on that a little bit. So if you could tell us how the standard health insurance fees work, since you've been in the industry for many, many years.
Okay, so I think we need to probably start with why we need standard health insurance fees.
Yeah.
And at the outset, when the law changed in 1998 or 99, I always mix up which date it was, the standard health insurance fees did not yet exist. And insurers, local insurers, were the only ones who really participated at the time, because I think they didn't know quite what they were getting into. And we could not attract overseas insurers because we did not have what you call a usual and customary rate or standard fee.
Mm-hmm.
It's a standard health insurance fee. So in the first 2 years of us having required health insurance, 2 Cayman Islands health insurers went bankrupt. Because the standard health insurance fees are a cap on what a provider can charge to the insurance company for any particular any particular care that they give. So let's just give an example. The standard health insurance fees today is a part of the health insurance regulations that are attached to the health insurance law. And those fees are a list of fees that follow the pattern of the CPT codes that are used throughout the US and the Western world in reality. And they are, so for every 15-minute or 10-minute interval, I think it is, for a visit with a GP, there is a fee associated with that. So imagine now you have a 15-minute visit with your physician and you are charged $200 according to the standard health insurance fees. Imagine there's no cap on that. And your physician sees you for 15 minutes and charges your insurance $10,000. That's what was happening at the outset before the standard health insurance fees existed. So without the standard health insurance fees, we would not have the robust health insurance community that we currently have. Right? Now, for all of the flaws within the system, that is one of the functions that I think we have done quite well with. The only concern that I have around it is that it has not been updated since
18 years.
It's been a long time. It's been a very long time. It has been reviewed but not updated. When I say that, I think that our government, and this is not this administration, but consistently throughout the last 20 years or so, our governments have been very hesitant to raise the health insurance standard fees. So the standard health insurance fees, we call them the SHIF, but they've also been very hesitant to raise the standard health insurance contract premium, even though the premium that we are collecting, and I say we, I mean the industry has been, I shouldn't say we, kind of really in the industry right now. The premium that is being collected for the standard health insurance contract does not really meet the need to be able to pay the claims. So what happens is the standard health insurance contract is sold to people who can afford only the standard health insurance contract. And a health insurance company who is living only on that is having a very hard time surviving in Cayman. Because we are paying out more claims on the standard health insurance contract than we are collecting premium for. I think there may be only one insurer that's doing really well in that area. Now, what happens then is that when you go above the standard health insurance contract, the health insurer is then able to price you appropriately based on what your experience has been. We call that experience rating. So your experience, and I'm kind of getting off topic, but I'm coming back to it in a minute. The experience rating for what we
I was going to say, it sounds like we probably need to have another health insurance.
That's okay. That's okay. I'm going to get back to the experience though of the standard health insurance. Of the standard health insurance contract. So the experience now of those fees is that you will go to the doctor and the doctor will charge you what they decide to charge you. They are not stopped to charge you more than the standard health insurance fees. Some doctors and some clinics and some places, and I think the HSA, generally speaking, will charge you the standard health insurance fee or below. However, if you go to a private physician and they charge you more, they have every right to charge you more. The thing is, they don't have every right to charge the health insurer more. The health insurer is capped. So as inflation has hit the community over the last 18 years, those fees have gone up and up and up in the private community. And let's just face it, right? Our healthcare provider community is not hurting. There's a lot of them coming in every single month. The Health Insurance Commission the Health Practice Commission is registering them at an alarming rate, in my opinion. But you're seeing the raising costs coming in, but the standard health insurance fee stays the same. So your insurance company is paying the standard health insurance fee that is in the law, and that's either 80% of the fee or 90% of the fee or 100% of the fee. You then have to pay your copay, which is either the 10%, the 20%, or zero, plus the excess over the standard health insurance fee. Okay, so if you go to the doctor and you're going to spend 15 minutes with your GP, and the standard health insurance fee says that 15 minutes with a GP is $100. If they're charging you $150, remember your insurance plan is going to pay probably 80% of that $100, right? So they're paying $80. You are going to be paying 20% of the standard health insurance fee, which is the $20, plus the $50 that they overcharge you. And when I say overcharge you, that's not a suggestion of misconduct or anything. They have a right to charge you what they want to charge you, but it is over the standard health insurance fee. Right. So that's where we are with that right now. So when you go to the doctor and you run out of insurance, it's all, it's because, first of all, there are caps on each category. If you have $500 for outpatient, and I heard the caller speaking earlier that $500 covers your dental cleanings, right? And it will cover your outpatient mental health, etc. But let's just be real about this. Within that $500 benefit, you have prescription drugs, office visits, a dental prophylaxis, which is your dental cleanings, and I think one set of bite wings or something like that. And then they have physio, etc. All of the outpatient benefits are lumped into that $500. That $500 is done after your first visit to the doctor and you go to the pharmacist. Realistically speaking, nobody uses that for dental. And in fact, the pharmacists don't accept it because they are unable to tell where you've capped out and whether or not they're going to get paid. So let's just talk about that a little bit. They go to the doctor and the doctor says you need to go and do diagnostic tests. Your $500 is blown, right? That same day you go to the pharmacy doesn't know if you went to the doctor earlier on today or how much that doctor is going to charge you. They have no way of knowing whether or not you have exhausted that benefit. They're not going to administer you drugs and then find out they're not getting paid and then have to chase you down. They prefer to charge you and then you go and you charge and you claim against your insurance. So the benefits exist within the CHIC plan, but you end up having to pay for it up front a lot of the time. And I know all right, my dear.
Yes, we definitely have to, like I said, have another discussion on this. But today was not meant to be the day, but I just wanted to briefly touch on it since Luis brought it up because he's feeling frustrated. I mean, these things are frustrating, but we got to do our part in terms of our own health, because a lot of the things that we are going to the doctors for fall outside the realm of preventative. They are, because we're just not taking very good care of ourselves. So I say start with what you can change and what you can do. And I'm in this category.
There's one piece. There's one piece that I wanted. You're right. There's also preventative. So there's actually a completely separate preventative benefit.
Yeah.
And you can use that. I think that's $400. So $400 a year for your preventative benefit. So use it. Use that. That's what you need to be using. But be aware of how you're being charged and ask questions of your provider. But you're absolutely right. We really need to know more about our own access, our own rights, and what we can do.
Yep. Thank you so much.
All right, I'll leave you to it. Anytime.
All right. Someone just said, Sandra, that jackass of the day photo looks AI. Check the license plate number. So here's the thing with AI. Yes, AI is assisting us, but that doesn't mean that the information is actually not accurate. So what we know, let me just double check here, that license plate number 129704 is the actual license plate number of the vehicle in question. So AI kind of put it together as a, graphics to say, move your vehicle, but the vehicle number is 129704. That's the actual vehicle number. So I can definitely show you the real vehicle, and I get it, because what it did was it made the plate yellow, like the old style yellow plates that we used to have. So maybe that's what is confusing you. But AI is not going to change the actual license plate number. It's going to keep that very much the same. So, yep, I'm aware, and that's the actual. So the background has been, touched up by AI, but that's the actual vehicle with the same damage in the back. And I think they even kept the sticker. Yeah, the back of the vehicle is the same. The only thing is they changed the plate from white to yellow. And I don't know why AI would have done that, but they got a little baby sticker in the back. It's a Jeep Laurado. Looks like it might have gotten hit. And where they have it parked, it's actually blocking the entrance to Cayman Corporate Center. So just go move your vehicle, folks. Just because you've been in an accident doesn't mean that you get to leave your vehicle there indefinitely. That doesn't make any sense. All right, let's do some housekeeping things. So yesterday we were asking our audience to weigh in and whether or not Carrie should be blocked. I mean, obviously, I like to take the pulse of the community. Ultimately, it is my decision to make. As the managing director and sole owner of CMR, there are certain decisions that I have to make in our best interest. But I heard your comments and I listened to your feedback. And drum roll, please, the decision has been made to block her from calling into the program. Now, that does not block her yet on social media. And I say yet, because she can still get in the comment section and she can still comment on what's up. What she's no longer able to do is call in live during the radio program. It's unfortunate that I have to do this, but if you have no self-control, then I can't help you. Okay, so this is a very simple thing. And I know I had someone even from the US listening came out and like, oh, I believe her. And I'm like, poor you. I mean, really and truly, this is not the first time that she's done it. So, I mean, you can't control yourself. Listen, when I'm ready, I will cuss like a sailor myself. Trust and believe, right? But I have complete control over that. Like I tell people, when you see me cussing, that's not a lack of control. I just feel like having a good moment where I can use some expletives in my vocabulary. It's not that I'm lacking the vernacular to say it in a different kind of way. I just want to use those words in that moment and say it that way, which means that I have complete control over what I say and what comes out of my mouth. And if you don't have that level of control, right? When you know that we have rules, I am here on Bobo 103.1. This is a formerly DMS radio station. It's now Stingray Media. I have rules that I have to follow from them, right? They in turn have rules from Offreg that Offreg is holding them accountable for. So under no circumstances am I going to jeopardize anyone's interest, certainly not my own interest, not Stingray Media's interest, and Offreg, because y'all just love to run to Offreg to complain about anything. I'm not giving Offreg no excuses whatsoever to be picking up the phone and calling me or messaging me. Okay? So after now this being a repetitive behavior, all the excuses in the world about, oh, the clock was wrong, or the battery wasn't in the clock, or this, that, and next thing means zero to me. After yesterday, that was just the final straw. So all I can tell you is in the poll, we did have a poll around this, and it was very, very interesting because we had 69% of you for the second poll question about how many chances should you get said no more chances. Only 31% said, oh, I'll give her one more chance. That's because y'all are sap for punishment. So that means 7 out of 10 people are done. They don't want any more warning. Just deal with it, Auntie. Do it like how you know how to do it. The first question, whether or not she should be banned, 64% of you said yes, 36% said no. So basically 2 out of 3 listeners were in favor of her getting banned. And I think some people didn't have the proper context. So when we followed it up with the second question to say, okay, this is why the use of profanity while we're still on radio, that's where you see the numbers then went up. Not just 2 out of 3, basically it went up to the 7 out of 10. Honey child. Anyway, sorry, Carrie, but you have to, and the thing about it is, she does have her own platform. She's on social media, and social media has different rules. Meta they don't care what words you use. That's why at 9:30, when we cut from radio, then we can take it up a notch. We can have our FAFO Fridays and whatever. That's why y'all be sitting here getting the Hennessy ready for 9:30, because you're like, oh, okay, 9:30, we're going to get real. No filters. Yeah. So we can't do that with off-reg when we're on an FM broadcast. Everybody knows these rules already. I'm just stressing them a little bit more in case any of you are confused about the decision that has been made. So she's been blocked. I know she has several numbers. I blocked the 2 that I have. Sorry, Carrie, if you have other numbers that I don't have access to when you call in, I will disconnect the call. So don't embarrass yourself. Just do the right thing is all I can tell you, honey chill. You only get so many chances in life. I mean, I feel like some of you grew up in households where you were given infinite chances. Like your parents, were like, oh, just do whatever you want, little Johnny Ebanks, do whatever you want. There's no rules. I'm like, y'all had I tell you what, y'all had a good carefree lifestyle with no rules, no boundaries, no nothing. And I was not raised that way. So sometimes it is hard for me. And that's why I like to take a minute before I make a decision, and I will listen to other people. I will hear their perspectives, and then I will still, make my decision. I'm open to having my mind change about a lot of things. And then there's some things that I just not doing. You know what I'm saying? So, yeah. Okay. That's all I'm going to say about that. Let's move on. Anthony, it's so funny. He's asking me this question about, did I get an email from CNB? I don't think I did, but let me check something now. Because you know what is so funny? Someone else just sent me the email that they got. And I get no message from CNB about if you want to skip a few months payment. Why are they doing it? Because of the gas prices? Let me see. I just checking my email again. Child, when y'all see my mortgage, I'll be like, honey, child, CNB not giving you no breaks on that. You better try and pay that. Here's the thing. No, I must not be in that category. Y'all lucky. You're lucky, but you're stupid if you take advantage of it. This is what I'm going to tell you, right? Nope. I don't see nothing from CNB about me getting an abatement on any of my mortgages, plural, with them. But I don't mind that, because here is the snippety snip of it. The worst thing you can do, right, is take a letter like this. So this is what the email said, because I literally at 8:57, someone just sent it to me. Dear Mr. and Mrs. So-and-so, congratulations, they say. You are eligible to defer your April and May loan payments on your Cayman National loan account ending in yada, 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 subject to the terms and conditions below. And then they list, processing fee of $100 per month. Deferred will be automatically debited from your standing order account. For joint loans, all account holders must provide their acceptance to process the request. So both people have to sign. Notwithstanding your decision to opt out, all terms and conditions of your loan agreement remain in full effect. Yada, 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 and blah, 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 and more blah, and blah, and blah. The reason why you do not want to do this, and you have to get back to them by Tuesday, the 31st of March. Somebody else said, we got that email too. I tell you, CNB not send it to me, and I do not mind in the least bit. Because the worst thing you can do with a mortgage is defer payments. It hurts you. It does not help you. You see, nobody's telling you guys this. Nobody's educating Caymanians on these types of things, right? You should be doing the opposite when it comes to your mortgages. See that? This is a little snapshot. I took out the people's names. This is it. And you feel like, oh, this is great. 2 months without a mortgage. If your mortgage is $1,500, you know what we can do with that kind of money? Listen, don't do it. That's right, CC. Hit that decline button so quick. Say thank you, but no thank you. Don't do it. You become the loser in the end. And bless CNB's little heart. I mean, I get it. You know, they're in the business of making money. All banks are. And I'm sure they're trying to help you maybe because they're thinking, okay, gas prices are going up. People are kind of, we don't know what's going on with this war. Don't do it. This is not an emergency. If you can still make your payments, make your payment and then some. Don't go shopping. Vicky, no. Go shopping. No, you don't. Cut the life of that mortgage. If you make one extra payment per year on the principal alone, you're able to cut the life of your mortgage significantly. I can tell y'all a little story, and I'm not trying to brag because, you know, you can't tell Caymanians nothing about your successes in life without them thinking that you're trying to brag. So those of you haters who believe, it's just about 9:30. Those of you haters who believe that I'm trying to brag, I want to show you a principle that you must understand in terms of how it works. I got my creates in here. By the way, we need to get up and do some squats. I got my co-host Zeus in here with me. I'm trying to have 5 milligrams of creatine supplement per day. And you just put the powder in the water. It forces me to at least drink a glass of water. And so I'm going to start drinking some of this now as well. Okay. So here is the snippety snip. The best thing that you can do is to try to get ahead of yourself on your mortgage and make extra payments when you can. So, you know, Auntie makes money. Y'all know this already. Like I tell people the other day, I was joking about there's some restaurant that somebody was going to, and you know, like a steak is $100 and all this kind of foolishness. I laugh when I see people making minimum wage and having to sleep with men. We're gonna get to them here in a second, to be able to afford their lifestyle, right? Sleep with multiple men to be able to afford their lifestyle. I'm just like, how are you going out to these fancy steak houses and restaurants and stuff like that? Some of them I could afford to eat there every single week, and I don't go. Because it's just wasting money. As my aunt says, big shout out to Aunt Topsy, aka Adonia. She says, you know, spending all this money on expensive food is kind of a waste because it literally goes in one end and comes out the other. You know, them old people, they're not messing with you, you know. They can tell you how it is. I mean, yes, it's great to have nice tasting food and whatever, but child, please. That curry chicken last night tasted pretty good to me still. But anyway, I not really too bothered by the fact that I've not gotten that email from CNB because I wouldn't take advantage of it anyway. Now, I'll be straight with you. I'm just coming out of a major renovation project. Somebody said the loan deferral CNB email's legit. Oh, I don't have any issues with believing it's legit. I know. I'm aware. I'm 100% aware that it's legit. And CNB might not like me for it, but what I'm going to tell you is it is in your best interest to pass. Right? Even when you qualify for another credit card and you're like, oh yes, free money. The highest interest rates that you pay is, she said, did I receive it? Nope, I not got it and I don't want it. Don't have it and don't want it. I got to keep hustling and you keep taking my money out. Because so must check spam. I have it. Nope, I'm not even checking spam. I don't want to see the email. I don't even want to be tempted because trust me, 2 months of what I'm paying for mortgages, she says for personal facilities. Yeah, they're not going to help me with the big ones then. 2 months of what I'm paying for mortgages don't make no sense, right? I want to pay extra. So several years ago, I had a financial goal. And my financial goal was to pay down my mortgage, get it down to zero. Okay. And so I called my bank manager and I said, right, what do I have to do? Like if I want to do this in 12 months, 24 months, how much extra per month do I have to pay on my loan in order to get that down to nil? And this is the part of the story that people don't want to tell you. You know, these haters out here, People like Chris Saunders, I heard that he was trying to talk my business the other day, but wouldn't mention me by name about, I want to know how Marwood, he didn't call Marwood, but how these media houses are making their money. I'm like, bitch, I make my money just like everybody else. Sell my services. I'm not selling my body. Okay. I am selling my services. You can buy ad space. You can come on the show. You pay for that, et cetera, just like everybody else. You think when you see an ad for these parties and events on whether it's everything 3, 4, 5, fully, whatever, that's for free? No, they're paying for that privilege. And rightfully, that is how, as content creators, we make our money. Chris is stupid. I'm not even going to deal with him. He just dumb, trying to hate. He better try and worry about how he getting his money because he's not even working for the people and still getting paid 10 grand a month. How about that? Anywho, let me not digress. Anyway, I was hustling hard every month, putting extra. And what you do is, right, you pay your regular loan. This is the key. If you're trying to expedite it, you make the regular loan payment. And then on top of that, you pay extra and you tell them. Now, you know, the banks are a business, so they're always going to be making their money. So you tell them, I want to pay $500, $1,000, whatever extra you have. I want to pay that on the principal. And honey child, if I could show you, because every month they would send me a little snippet, like, okay, we put 5 grand, we put that in the principal. And you know what happened? Not only did my principal amount go down, but the interest that you're paying, because you know the first 5-10 years of your mortgage, depending on how, you know, the life of your mortgage, the interest that you're paying or the loan amount is primarily interest. So by the time I started to get past that stage, wowee, I could see where the principal amount that I was paying all of a sudden was way more on the principal than the actual interest. Like, it was interesting to see the correlation between principal and interest. Principal and interest. You bring that principal down, you're bringing that interest down at the same time. I remember at year 5, I said, okay, I'm going to sell my Benz, you know, I'm going to do a little upgrade. Remember I told you guys for my 50th, I was going to treat myself. But here was the caveat. I was not going to treat myself to the new car because that was for my 50th. I was like, yeah, we can do it, you know. But the caveat, the goal for me is I couldn't get there. I couldn't do that because that's not a need. There's not a need for me to upgrade my car. There's not a need for me to have a new Mercedes. That was a ooh la la for my hard work. I'm going to be rewarding myself. Yeah. But for me to reward myself, the financial goal was get that mortgage down. Then, and this was even Marla and I, yep. Okay. Don't say nothing to me about what I got to spend on the Benz because I'm going to pay the mortgage down. Okay. Let's do it. Honey child, when I sold, and these are, you know, make sacrifices in life. When I sold my used Mercedes, now, you know, Mercedes, they retain their value. They're excellent cars for that, right? I got over $30,000 for that car. I didn't owe nobody because I'm not in the business anymore of getting car loans. So whatever cars you see me driving, I'm paying cash, straight up, right? But this is, you got to work it. You got to get to that stage in life. So I said, okay, that $30,000 now, that is money in my pocket. I could do anything I want with that. Oh my Lord. You know what you can do at 30 grand? You know, oh, that would be amazing. I mean, you could, oh man, the vacations I could take with that, the shopping sprees, as Miss Joy said, Vicky. Oh my God, ooh, here comes the mall. And I said, oh no, honey child. As soon as it hit the bank, I messaged CNB, take that and put that on my mortgage principal right now. Don't even make it sit there for 2 days. Because God knows you'll be tempted to, ooh, house renovation. I need this, I need that. No, no, and no. And when you drop that kind of money on a mortgage, Lord God, you really see what a difference it makes. Yeah? But you don't have to, it doesn't have to be that big. $500 a month, $200 a month, $100 a month. And you know, you can set it up with them where you say every month, I've done this with one of my mortgages, you know, let's say it's $1,200. I say, you know what? I can afford to pay $1,500. So every month, take out $1,500 instead of $1,200. So that automatically I'm paying that one extra payment per annum anyway, because I can afford to pay a little extra. Now, interest rates going up and down, thanks to Trump, they're probably going to be going up again soon. They've dropped more recently. These things can make a difference. But we have disposable income that we choose to spend it on different things. Listen to me and throw that disposable income on your mortgages. That is your single biggest investment in your life. And when you see the interest that you pay on a 15, 20, 30 years, some of y'all have 30-year mortgages. You're buying a house for $450,000, $500,000. It is crazy the interest that you pay. So the quicker you can bring that down, the better it is in your interest. So thank you, CNB. I have not seen the email to me. I don't need to see it because my answer is going to be thank you so much. Y'all know I love you as my bank, but my answer is a definite no. And I would encourage you all to say no to this if you are not in dire need and you don't need it. You can still pay it, It's not like they're shaving off 2 months on your mortgage that you will never have to pay. You still gonna end up paying that plus. You understand? So just leave it alone. Don't even, meh. And then here's the great part about it. Because I could show a commitment to getting my mortgage down and getting it down and paying it down and whatever, when I then went to CNB and said, oh, now I would like some investment mortgage, and some investment property. And yes, it's in a nice, beautiful area with multi-million-dollar homes and yada, yada, yada. CNB kind of looking at me a little sketchy, like, boy, we don't know if she's a little black Georgetowner. I mean, we don't know what she can really afford. The one thing that worked in my favor, because these people don't know you overseas, right? But this is why it rides with CNB. My local account managers and local people here could say, listen, we're going to go to bat for her in her application because we saw the discipline over 2 years of her bringing down her mortgage and making extra payments every single month, right? On top of her mortgage. So she's committed. She's thinking smart. And that made a big difference in me even getting that loan approved. So you can imagine. Now, I need to get back on track. I can be honest with you. Because I've had a couple like renovation projects and some other stuff going on. So I have been off track and paying extra. But starting this summer, mama jumping on top of it again. Good morning, caller. Thanks for your patience, honey. Shea.
Good morning.
How are you?
This is your batshit crazy antagonizer.
Well, I know we got some of them, and I don't know that you'd be in that category, but anyway.
Well, I was told that was my navel, so I just couldn't wait to use it. Anyway.
No, we got some. If this was an award show, I'm not even sure you'd be nominated because we got a lot of them around the place.
Oh, right. Okay. So no prizes for losers. Sandra, sorry. I would like to touch on two things, actually 3 things, if you would allow me. And maybe I should do the 2 that I know won't take so much time, because the other one, I'm pretty sure that you may not agree with me. But as you spoke about your writer, your listener, so this letter from CNB, my advice to anyone that receives letters from banks or any establishment, before you act on it, call the bank. Sometimes these are not coming from the bank. And if you were to call the bank would say to you, no, please don't do anything. This That's the first thing. And the other thing, the advice you gave is absolutely correct. If you can afford to pay, just continue paying it. And even when interest rates drop, because they will eventually, then your bank will suggest to you that they can lower your payment. I would say if you can manage to continue your payment, leave it there.
That's right. That's right.
That money then goes to your principal, and the more you can pay your principal down, the less interest you pay, because the interest is calculated on your principal. But Sandra already gave you that lesson in class this morning.
Yes.
Okay.
Yeah, and it makes a difference though, Miss Brenda. I gotta be honest with you. Until I actually saw it, like you hear the idea and you're like, oh yeah, okay, that's it. But when you actually see like the screenshots they would send me monthly and how it was coming down, I was like, oh my gosh, this is amazing. Makes a difference.
Yeah, it can be very tempting, especially for people who are struggling, you know. But like I said, even if you don't have $1 left, if you are able to make your present payment, stick to that, you know. And again, the most important thing with receiving these letters, regardless of which bank it came from, call the bank and ask them, ask for the person, if someone, you know, if it's signed off to someone's name, ask to speak to that person, because this has happened to me. And I called the bank said, please don't, we hope you didn't do anything, don't act on it. That person was act, and we're trying to sort it out. So you know, the other thing I wanted to touch on,
and just to be clear, my account manager has already reached out to say this is a legit email. She said, you know, I should have it. So there's no question. And the good thing about how CNB did it is they didn't ask you to like click or anything in an email, which those are always suspicious. What they just said to people is email so-and-so directly if you're interested in doing it. So, you know, those are a lot less likely to be spam, but you can always pick up the phone and double check.
Exactly. But like I said, that would be my first bit of advice, you know, make sure it is coming from the bank.
Yeah.
But anyway, so the next thing that I wanted to say, this, what I said just now is what brought me to this. Flow. You know, Flow was being scammed and hacked for so many years. I kept getting stuff from them. And of course, I don't live far from Flow. So I'd go out there and I'd say, I got this one. And they'd say, no, don't do anything. That's not from us. Just delete it. Whenever you get these things, just delete it. So that is what I got used to doing. And then in February, I started to receive emails from Flow, which I have to be honest, I just skimmed over it. Didn't even really read it. And I got about maybe 2. I was off island. I got about 2. And then I got home and I got 2 more, I think. Anyway, so by this time, I read the email and it was regarding the email addresses that we have with what used to be cable and wireless. Those CANDW.KY. And I decided to call someone that I knew had one of those email addresses. And I said, you know, I got this thing. It was actually on the weekend. So but you can't call through because you ain't getting an answer. So that was a question. So I called the person and I said, do you know? And before I could finish, the person said, that is legitimate. You need to deal with it. And in the email, it actually had a thing and it said, let's press this link. Again, you know, that's what they tell you not to do. But the person did go on to say that, you know, what I needed to do was get someone that knew about IT to assist me. So now my email says that I needed to deal with this before the 8th of March. And the day I was doing it, it was prior to the 8th of March. So I called the IT guy. He came over. And when we read into this thing, a big, bold red screen said this account had been closed and deleted. So, and at the time, I was extremely hoarse. I had no voice. Like I say, I'm IT illiterate. So I asked him then to call the main number and let us see if they had a robot that would talk us through this process. So as they thought they might ask me questions that I can't answer. So anyway, because he was suggesting to call now Monday or whatever. So called, someone answered, and of course it's always hold on. And then this person was saying, oh no, those accounts are not closing until June. He said, well, hers is already closed. And they hold on, then they come back again, and then they said, oh, she needs an alternate email address. Okay, luckily I had one, provided that. And so the process that they're now doing is you don't have access to that email address with them. But if you were to send me an email for it, they will then forward it to that alternate email address. Now, I don't know if come June, everything will be shut down.
So this is what? These are those Candiwacky that Flo has had forever? So they're shutting those down?
Yes, they're closed.
Oh. But you see, this is the sort of thing, like Flo does not send out any press releases or anything to the media. I think they actually have...
that was the point I was about to make.
Yeah.
They did this, yet they didn't say anything to their customers. They didn't, and I started out by saying they're so used to being hacked and scammed. You don't know, that this was really coming from them. And I think for something like this, that I know affects a lot of people, they could have done a press release. They could have come on your show. They could have gone with OC. They could have gone with Charlo. They could have gone with anyone and make this announcement. They could have gone to Compass TV. That at least we would have known that this was going to happen.
Yeah.
And now what I suspect that will also happen is because the way I see it, I don't need them to receive my emails and forward it to me to another email address. So I could advise my contacts, this is not my email address, so this is the one you send me stuff to. That way I can tell Flo, now come and take your modem and you line up in my house. Okay? So anyway, but I just thought that I would say that because I'm sure there were many people that received that email assuming they have an email to send it to, and they didn't act on it. Or maybe like me, they just thought it was one of those scams. So I've been meaning to say this, but I've been having a little laryngitis problem. So I wanted to
I mean, we have, we've tried with Flo. I do understand that they do have a new communication / marketing person in place. So hopefully, they will be stepping it up. But yeah, their lack of communication, generally speaking, over the years has done them no justice. I mean, it has been a disservice to the community. And, it's almost like you get the sense that they don't care.
Well,
so I don't know.
Let me just say that when the call was made, I don't know where in the world the call was answered, but it wasn't in Cayman. Okay. The person, if I had to guess, I would say their accent was Guyanese, but I'm not sure. Yeah. And just like Logic has outsourced everything and they didn't tell us either. And when you call, now you're being answered in Guyana. Okay. Yeah. And you're not getting better service because they decided that they would not mail you your statement anymore. They would send it to you by email. Now they don't send the statement. And even when you have made the payment, you don't get the saying that you've made your payment, which that used to happen. So every month I have to call and say, can you please send my statement? And anyway, so that's a whole nother story. And the third thing I wanted to touch on, Sandra, and like I said, I know we may not agree here, but I'm going to say this to you. Yes, you have to protect your business, and yes, you have to abide by all rules like everyone. This is regarding Kerry being blocked. I was thinking maybe if it is possible, if she, is breaking the rules, well, block her during the radio time and then unblock her after it's okay, because you curse after the radio too.
Yeah, the problem with that is that requires, because somebody said that yesterday as well, that requires me actively thinking about Kerry every single day and taking multiple steps every single day to do that. I ain't got that kind of time. I see. I do it, but I do it by just controlling myself. Up to 9:29 and 30 seconds, I don't use profanity. After that, we're good to go. But that doesn't require me doing it. Like I would have to physically go on the phone every single day, block her, unblock her. No.
I just thought maybe it was something you could, automatically set.
No.
That would have been my, contribution to it. I wouldn't go one way or the other. Otherwise, like I said, you have to protect your product. And, I call your show, but I have never, even if it's after,
Yeah,
hours,
you remember where your mama used to tell you that she was going to wash out your mouth if you cursed.
No. Let me tell you something. My mama didn't threaten us and tell us anything.
Oh.
You broke the rules. Oh, no, she was the disciplinarian in the family. My dad, my dad never beat us. If you did something wrong, then he gave you that stare. You wish he had beat you instead. But my mother, she was the one that did the beating. So, like I say, you didn't cross your line with her. And she wasn't into washing out your mouth. And if you embarrassed her, she said she was going to punish the crime where it took place. So, in other words, she was going to take you back to the scene, and that's where she would discipline you. Or if it was happening there while she was around, which we wouldn't have done. But that's the way she was. Like I say, she kept us walking the chalk.
Yep.
You didn't mess with her. She was a strong disciplinarian. She did it very differently than our father, but I say it worked.
Yeah. Thank you so much, my dear. Appreciate it.
Right.
Yeah, and the unfortunate thing about Carrie is, again, when you block a person, right? So even if she wasn't calling in, because oftentimes she calls on WhatsApp, now she's blocked. Like, I can't just block her just from calling, because when I block on WhatsApp, that means that she can't even message on WhatsApp. But this is why she needed to think about her actions. And like I said, this isn't the first time. And I can't keep giving excuses to Stingray Media or giving excuses to Offreg about why I can't control my people calling into the show. And the truth of the matter is, we're in the process now of hopefully getting your own radio license. Our application has formally been submitted. If there's any time that I need to definitely demonstrate that I understand what the rules are and I will enforce them, the time is now. So it's unfortunate. Carrie, I know I see you there talking about please block me from everything. It's okay. I know you're going to be in your feelings about it, and I just can't help you. You know what I'm saying? The rules are the rules, and they have to be applied for everyone. And on that note, tell Thelma Lou that she not block, and I said hello. She can keep watching. Poor thing. Anyway, moving on. Abby says, to be honest, I'm upping my car payments from $650 to $1,000. I'll pay the loan off 22 months earlier. 22 months, and I'll be saving $2,000+ in interest. Hello. Good for you, Abby. I'm so proud of you. Yeah, sometimes you don't have the money to pay cash, and that's fine. But listen, I tell most people, most of our purchases are foreseeable, like, you want to get a new car next week, or not next week, but next year, the year after, whatever. Start saving up for it. Pretend like you have a car loan before you get the car. So that when you go in to get the car, instead of saying, I need 100% financing, you give the dealer $5,000, $10,000 down in the car, and then you only have to finance the balance. And then on the balance, you do what Abby is doing, and you expedite those payments. Yes, girl, I love it. Sadiqa says, yes, Auntie, thanks for the financial education the banks don't want us to know. Kaboom. I'm still looking for a sponsor, and I'm hoping one of the banks will do the right thing. Not for nothing, but they can do it. To come on the program and talk about financial literacy. Do that. We know y'all make your money, and you're going to make your money no matter what, because it doesn't matter how much we're going to preach to people about financial literacy and doing it the right way and making extra payments. There will always be that portion of the population that they're going to live paycheck to paycheck no matter what you doing, honey child. You You could be practically handing them all the common tips and tricks, and they can still be out here doing foolishness. So the banks will always be making money. And I think, educating 20% of the population, but we definitely need financial literacy as a ongoing, option for people. But when people in the business of making money off of people not being financially literate, you can kind of see how they might feel conflicted. Adrian, who are you talking about? Good job, Abby. I'm proud of Abby. That is a great job. Good for you, girl. Cindy says it must be nice to have it, honey child. Nobody starts off this way unless you're born into a family. And none of us were born into a family. You start by making everyday decisions. Some of those decisions didn't get you anywhere, or you failed, and you do better, right? What's the definition of insanity? Making the same decisions all the time and making the same decisions and expecting a different result. The only way you're going to do better for yourself is to make better decisions, right? So what you didn't know 5 years ago, and now you do know, then do better. So I'm not speaking as someone who has gotten it right my entire life. Nope, I did it wrong too. There were times that I was more concerned about that new iPhone and running to Miami to get that the weekend that it came out, as opposed to actually paying down extra on my mortgage. That was me, but it's no longer me, Cindy. And that's the point. Even if you're making those bad decisions now, you can do better. Cindy says, Digicel once tried to get away with hundreds of dollars in internet bill. We legit had to go in to clarify we didn't owe what was reflecting on our account. And that's the other thing too, is keeping an eye on your account. There's so many things that we sign up for too, like all these services, Netflix and this and that. And half the time you forget sometimes what you sign up for. Every once in a while I go into my PayPal account because you pay for stuff on PayPal. I log in, I go to my PayPal account, and those automated payments, you can actually go into PayPal. There's a specific section in PayPal where you can go in there and see what you have on auto renewal. And then you are able to delete those, to cancel those. And so every so often, because I forget, I signed up for this program a year ago, wasted money because you never used it, whether it's an exercise program or whatever. Let me tell you, honey child, I go into my PayPal and I clean that out. Cancel. I'm not paying that again because I never used it. All these subscriptions for this, that, and the next thing. Cancel those foolish things and start saving your coins. Waking Up, the Cayman Islands says, please be aware that bank loans are a scam. Banks use your promissory notes hoping to possess the property, create money out of thin air, lend you other people's money. Bank loans are illegal by law, a Ponzi. Well, they're not illegal by law, or they wouldn't be able to do it. They are regulated by SEMA and other pieces of legislation. And listen, we all need the banks. Most of us do not have the ability to not have a bank loan ever in our lives, right? Like I said, the one thing that you will spend the most money on in your life is your mortgage. And so, how many of y'all have $500,000 just sitting in the bank? I'll wait. And even if you have that kind of money, you're borrowing at a different level, because then you have a, $5 million home that you out here getting, even if you have $500,000 or $1 million sitting there. A lot of those rich people, they're not got no money sitting in the bank either, They just know how to leverage the loan system. And in the US in particular, right? A lot of these millionaires, they don't spend their own money. They tell you that. The guy who goes around interviewing billionaires and millionaires and stuff like that. One of the constant messages that they use all the time is, don't use your own money. You don't need your own money. And so use other people's money. And there's systems and different things in play in the US where you can do that, where you can leverage those options for you. So yeah, it is what it is. And we don't necessarily have that level of creative financing options or whatever here in the Cayman Islands. But those who have it, that's how they get rich, using other people's money. They don't put up their own money. They're like, nope, that's too much risk, and I'm not going to take it on. So there you go. Let me see here. So, yes. All right, Sandy, you probably have to ask a former banker to come on to explain. Yeah, that would be good. We'd love to have them on. So yes, I mean, the loan system in Cayman is a little bit different. I understand that. I think Mr. Balika has called into the program previously and explained all of that to us, but it's still, in this jurisdiction, it's still a loan. You guys would do well with reading your loan documents and understanding how it works. Yes, it is a demand loan, but here's the thing. Banks are not in the business of just walking up to you for absolutely no reason at all and say, oh yeah, last year you borrowed $500,000 from us. Now you just have to pay the full amount. No, because how they make their interest, it's in their best interest for you to pay on that loan as long as you can, because the interest is where they make their money. So if you take out a 20-year loan for $500,000, let's do the math real quick, simply. 20-year loan for, say $450K. Interest is what? 7%? I don't know what it is these days. Let's look at the breakdown. They get you on the interest. So, right. So 20-year loan, $450K, 7% interest. And of course, your interest is then spread out 7% annually. It's spread out to a monthly rate. That's 20 years is 240 months. That's your loan summary. Your monthly payments would be $3,488. The total that you're going to pay over 20 years is $837,000. So you're going to pay almost the same that you're borrowing. You're going to pay that in interest. So the interest for the time period, $387,000 when you borrow $450,000, and you have to repay the whole thing. Okay. So you're paying almost as much as in interest as you are in the loan itself. So that's why even one extra payment per year, let me get this for you. Paid to the principal, and you got to tell them when you send it in, you tell them, I want this to go on the principal of the loan. All right. So what happens if you pay one extra payment per year? Here it is. One extra monthly payment per year applied directly to the principal on this exact same loan, right? Allows you to pay it off in 16.5 years instead of 20 years. So you're saving 3.5 years of the loan. Caymanians, listen to me. One extra payment. This is the beauty of it. Imagine if you could do 2 extra payments a year. Huh? One extra payment per year allows you to pay it off in 16.5 years instead of 20 years, saving you 3.5 years on the loan. Now let's talk about the dollar amount. Your total interest originally was $387,000. Your new total interest is $290,000, basically saving you anywhere from $95,000 to $100,000 in just the interest alone. Why? Because that payment to the principal reduces the balance quicker, lowers the interest rate charge each month after, and compounds into major savings over time. Just one extra payment per annum. Do it. Find the money. What is it for most of you? A vacation? A trip to Walmart? You know what I'm saying? Not buying the fancy electronics every single year. Make the sacrifice because you can get out of your homes out of the bank with your homes a lot quicker. And here's the better part of it, because I know that it is challenging to think of this and like, oh man, okay, my payment's $1,500 a month. Where can I find $1,500 extra a year, Sandy? I don't know. Break it down into monthly. You can do so many things in life when you take it into small, manageable bite. That's the same thing with our diets, right? We can't imagine, oh man, I got to lose 50 pounds. I can't imagine doing that. One step every single day. Start off walking for 5 minutes after your meal. Increase it to 10 minutes after, just small, manageable bites. So if you did it over that same amount, the same scenario, to get to that one extra payment per annum, if you set aside or you told them take out $290 extra per month, that's all it breaks down to on a monthly basis. $290. And it has the same effect of the overall savings. Yep. That's what I tell you. I can't remember on one loan how much I'm paying. But anyway, when I saw it, I said, you know what? Put a little couple $100 extra in that each month. And then when my interest goes up, I'm already ahead of the game, because interest can fluctuate as well, right? Right now I have fixed interest anyway, but because God knows with Trump trying to run the world, we all in a world of trouble, honey child. So a trip to Miami, I need to check out Amazon. Strong wills, I feel you. I don't know, waking up. They can come and tell us the secrets, and because the secrets aren't that secret, just that we have to enforce it into people to know that this is within their control, and they themselves can do it. Nobody can't not tell you to make an extra payment on your loan, but the banks operate on the premise that most people not gonna do it because there's no discipline there to get it done. I was gonna do expose on a customs officer and her husband, but let me just see by popular vote here this morning, should we do that now or shall we save that until tomorrow? It's already after 10 o'clock in the morning. I know some of y'all be needing to get at work. So let me know if we should do it now or we should get to her and her thieving husband tomorrow. Another marriage of convenience, of course. Good morning, Miss Sandra. Happy Tuesday. Thank you for such an educational and informative show this morning. I hope people take this information in and apply them. Thank you, honey child. Let me just see what else is coming in. Oh, we have someone from Goa, India, who is looking for a job. I get these all the time because they oftentimes find my number on social media. And so they're always, I'm a vigilant and ambitious person having an experience of over 10 years in wine liquor industry, seeking a position as a bartender. I will be overwhelmed if I can get any job placement, hoping to get a positive response from your side. Well, I'm not in the wine, liquor, or bartender business. And I'm also not running any immigration scams, unlike LSJ recruitment services. So I cannot help you. What do you say his name is? Hermant Narvikar Porting. These people are desperate. And this is the single most reason why it is so egregious that they are being taken advantage of. Yes, I don't want people to be taken advantage of in my country because it makes us look bad. We get a bad reputation. We get a bad name. But on top of that, I really do legitimately feel sorry for them. Morning, I hope all is well. I wanted to comment on this morning's show. Most health problems don't start at 40 or later. They start at 25 with the decisions you make about diet and exercise. Kaboom. Another person says, this is a continuation of that one. Example, here in the Cayman Islands, we love our local cooked food, but many may understand or not that our cooked food is mostly unhealthy food. I love my cooked food, but I have cut down 80% of consumption of local food, such as that fried chicken from Corners. they said the fried chicken from Corners, then they put the I heart it. Oh my God, you can tell they love it. We have to do better with our dieting as a community. Absolutely. And, the thing about a lot of those fried chickens is the way that they're being prepared. They're being deep fried in seed oils. Listen, you can have fake fried chicken, Do y'all know how to make fried chicken in the oven? Or you can do it in the what's some things now that we all have? Oh Lord have mercy. What the hell they call again? That's on your countertop and you can put your little fried chicken in there. Y'all know what I'm talking about. Them. I can't even think of the name of them right now. I have one. I don't know that Miss Stacy really uses it that much, but anyway. I've been sitting here from 7:30 for you to bust up the story. And now you talk about tomorrow? Talk to teens, says this person. Lord have mercy. Ay. Okay. This person's like, no, you better tell me now. People are going to become more desperate due to Trump's shenanigans, says this listener to the program. This person says, hi, do the expose now. I'm flying out tomorrow. Morning. I'm not sure what bank you're referring to, but I was paying half my monthly payment for years and didn't get those results. I have a standing order that went directly to my principal and I didn't see any difference. Girl, I got to ask you one question in terms of which bank you're dealing with and tell me if it's them. Good morning, TD. Try to plant that bank information to our heads. Hard-headed Caymanians would try keep on a land and homes because our people are losing their homes. Yes, kaboom for you, Sandy. Oh. What is this now about authorities at Tampa Airport? What's going on? Let me see. What's going on in Tampa Airport? Authorities at Tampa International Airport said Monday they're not aware of any plans to bring federal immigration officers into backup TSA. The airport is not among a list of 14. Oh, even more reason to fly into Tampa. TPA, here I come, honey child. Listen, they in Miami, they dragging people down. They doing the most. They are so stupid and so ridiculous. And you know what is so funny? They're just sitting there. They're not really working. This is the best part. Air fryer. Thank you so much. Yeah, this is the best part about it is they're literally standing over the agents who are actually doing the work. Their excuse is supposedly they are there to help because, a lot of the TSA agents didn't get paid. So they're not going to work if nobody not paying them. Hello, America. Government, get it together. And so, yeah, it's pretty wild. And they claim that this is why they're going to be deployed, but that's not even what they're doing. They're not doing that at all. But there's a theory that Donald Trump is trying to do all of this in order to get ready for the midterm election because he's going to deploy these ICE agents to interrupt the election. If you're hearing it first, you're hearing it first. Yeah, that's such an unfortunate thing. Let's do international topics tomorrow because that Air Canada, then there was a flight crash with the Colombian people. That was like, 100 people in that one? Oh, my God. And then there's some explosion yesterday in Texas at a factory. Luis, what's up with the news with Lamardo Scott and his Filipino wife scandal? If so, this is very concerning about people coming to these islands doing such things. Well, Luis, go back to yesterday's show, hit the rewind button and watch yesterday's show because we really broke it down. And what I would say is this. First of all, she QuickTime deactivated her Facebook account. Child, I'm not going to help you. And then he unfriended me. He's still there, poor Lamardo, but he unfriended me, so I can't see his account, or so he thinks. Lamardo, I try to give you the benefit of the doubt because I know you're not the sharpest. However, you know what your wife is doing. You know what scameration is going on with your wife and how that is allowing you guys to have a financial position over people. And it is just wrong. Like, I can't condone this kind of behavior. I'm not going to recap the whole show, but we did do a comprehensive story on it last night as well For those of you who don't necessarily watch the show, we like to do, a little, story to kind of bring everybody up to speed. What I can say to you, let me show you this. For those of you who may not read, when you have not one, but 9 business licenses, 9 business licenses. I want y'all to think about this for 1 second. Where you're doing everything from landscaping, mobile restaurateur, retail, online retail, retail by order, auto and boat washing, general maintenance, mobile salon and spa, domestic helper, payday lending, another restaurant license. This now was the KVT bar. And she was there with Dawn from Vine and Tap. When you got all of this going on, plus the recruitment agency, exactly. Strong will. Ross is right. Lad is right. Listen, I have a few business licenses. As a matter of fact, I decided not to renew one the other day because I really, I was kind of hanging on to it to keep that bank account open. And I was like, I can't even be bothered with that because I'm paying you more in fees. Didn't make any sense because I'm like, okay, I don't foresee myself going back into that. So I just, cancel the business license. This man has 9. He's doing everything under the sun. Here's the problem with that. As them old people say, the devil's a liar. Lamardo and his wife are the ones who are the liars here. What they are doing is they're taking out all of these business licenses to be able to float the fraudulent work permit applications, temporary 3-month applications that they are submitting. They are taking advantage of the system being too slack because the system it's too easy to get a 3-month work permit. You know the number of people that have reached out to me about this scamming duo? So there's more to come. Trust and believe there is more to come. Robert, mobile spa, domestic helper, payday lending. Huh? Was WORC aware that all of these? So let's figure this out. I'm going to do a few squats while I'm talking to y'all, but let's figure this out, right? You have a recruitment agency. Yeah. And in your recruitment agency, you're recruiting and then claiming that you have jobs for people. You have jobs for people in these fraudulent companies. Did they not put it together? That they could, Real Deal is putting in for their car wash service another one. You understand how this could really, imagine if you had 5 per month work permit applications, temporaries for each of these companies. 5 times 9. Right? You do the math and then see the kind of money, because apparently what I'm being told that people that know, they're like, Sandy, the little $2,000 and $2,500 you talking about, that is not what they're really charging people. And then they're also working with other companies who they're getting a cut of the pay of the shakedown money, right? For these poor people to come here. And so they're pretending that, oh yes, I have a contract with them. They need to start scrutinizing these contracts. Now, I'm going to say something very controversial here this morning, and y'all not going to like it. But if you go back to the poll question that we had in the channel yesterday, and you see this one that basically said, is it time for our government to start to penalize certain nationalities? Please go vote in this poll if you haven't already. It is time for our government to start to penalize certain nationalities because there's a higher instance of fraudulent activity, that is being committed by those individuals. Let me tell you why this would work. There is social conditioning here, peer pressure. Y'all know how peer pressure works? Y'all should be aware from when you were a kid, right? Your little friends, oh, my man, everybody's doing it. Yeah? But when you have collective responsibility where, okay, one does it, I can hold you all accountable. I didn't really grow up in a household with other children, but I can tell you what, I know some parents utilize this strategy all the time. They have 3, 4 children. Somebody broke the plate and nobody not coming forward. Guess what? Every single one of you gonna be punished. All of a sudden, you hear the story changing. My man, it was Mary Sue that did it, you know? Y'all giving up. Who did it? And then some people can tell you, I don't care if Mary Sue did it. All of y'all was running around this house like a bunch of hoodlums. You wasn't doing your homework. You wasn't sitting down doing your reading. Yada, yada, yada. Mommy got to bring down the hammer on everybody. And then you know the pressure that puts to bear on these persons. Yeah. All of a sudden now, we will have everybody like, boy, if I don't behave, my siblings are going to get in trouble. And then they got to blame me. And they got to deal with me. So maybe this is the approach. And, you know, we're kind of doing it with companies anyway, when you think about it. But maybe now this is the approach that we need to start taking. We have too many scammers in this country. And they're targeting this work permit system hard. So she is a prolific one, very well known in the Filipino community. And she's also, yes, Damien, she's also taken out work permits for Nepalese nationals and stuff as well. When you start to say, if you're from the Philippines or you're from Nepal, we're going to start to severely restrict the number of work permits that will be approved from those regions, because we have ample evidence to believe that they are defrauding the people of the Cayman Islands. Guess what? Y'all got to start to get your shit together. They're going to start to pressure. They're going to be less likely, because immigration will work with the people who have been victimized by this. But they're part of the problem too. Because of their desperation to get to Cayman. And you see the guy messaging me this morning. That is desperation. These poor people are desperate. We think we have things rough here. They got it even roughest. That is why they will message a total stranger. This man don't know nothing about me. I could be, you know, a horrible person. I got to whip him every night. And you know, I don't have a bar, but let's say I had one. I got to make him scrub the toilets, and I'm going to treat him the most ridiculous. They don't care. They just want to get here. Getting here is the most important thing. Once they get here, they got to figure it out from there. And that's what they do. They'll move from pillar to post. All of a sudden, you see them start switching jobs and all kind of stuff. They got to make it happen. Those 3-month work permits are being abused. We have got to put a stop to them. They're not stopped yet, Miss Brenda, because the changes, the work permit changes, have not been put through, so that can't be correct. They can still put them in. We got to stop it. But you better believe, even with a 1-year permit, they're going to still be trying to hook or crook their way in. So all of my friends in the Filipino community this morning, I have a question for you. How would you feel if the government said no more work permits in the Philippines because people like, what her name is, Nydia, are a bunch of scammers and are bringing people into this country who don't have jobs, don't have any money, and then that leads to additional things going on, including prostitution. Because when you come here as a woman and you don't have any money and you can't pay your bills, just like Michelle Guevara, what are you going to do? You got to latch on to somebody like DJ Ryan, DJ so-and-so, Mr. Ebanks, some lawyer she was on with as well. All these people to try and pay her bills and have the lifestyle that she's always dreamed of. Prostituting yourself. So this is no joke. And Lamato, you might be up in your feelings about me this morning. I know you're upset. You unfriended me on Facebook. I don't give a shit. Let me be very, very clear. Because what you're doing and because all these business licenses, by the way, are in your name. Now, I don't know the company. You know what? I can go do a company search here today. Don't worry about that. I can see who owns the company. But the LSJ, that's LJS. When I was looking at the name, I said, oh, that's Lamardo's. That's actually his initials. I don't know what the J stands for. Only God knows, probably James or something. Lamardo, James Scott or something stupid. But that's his initials. That is him trading as LJS Recruitment, right? Although your wife is the one running the scam, you have allowed her to do so. The business license is in your name, and you are going to be held accountable for it. You are allowing your wife to, 1 second here. Morning. Yes, sir. Not bad. How you doing? Yeah, drop it back to him. That would be good. And then I can get a ride to pick up my car. All right, thanks. Quick question. When you take mine, how much time do you need? In that case, I think I got a few things to do tomorrow, but I wonder if you shouldn't just take mine now. A day meaning, or you don't have capacity to take it? Okay. All right, let me book me in then for when you can take it. All right. Okay. Yeah. No problem. All right, my dear, thanks. So, yeah. So I don't have no respect for you, Lamardo. And like I said, if you up in your feelings, then that's too bad, too sad. That don't impact me one way or the other. What impacts me is the fact that this country is going to hell in a handbasket. All right. So Lamardo Scott trading as LJS Recruitment. And then the other ones, all the other licenses are under this deal, Real Deal, came out, Real Deal Ltd. Let me just check out. So they got Calming Touch, Solid Services. They have one that says Real Deal Trading as Servicing. Well, what kind of stupid name is that for a company? Servicing what? That's supposed to be the auto body. So they don't even have a real name? They didn't even bother to take out a real name? This is how they're scamming the government. All the addresses are right here in Grand Cayman between, let me tell you now, Block 25C parcel. This is all public information, so not telling y'all nothing that you can't find out. They even have a payday lending business, Express Loans. 5, I mean, something not adding up with these people, you know. Okay, look at what else I just discovered here. Now, y'all tell me how this make any sense. All right? You see what I'm telling y'all when I tell you that no one is checking these things? We need better enforcement and we need better investigative skills. How is it that the business licenses for these companies can all have different addresses? So Block 25C parcel 239H5. How can that be the same block and parcel number for two different addresses? Look at it and tell me. How can that block and parcel number be number 5 Whisper Court, Georgetown, and then at the same time be 5 Litigate Court, Raven Avenue, Spots, Newlands? You can't have the same block and parcel number being a different physical address. That don't make no sense. You see what I'm telling you? These are the things that do not add up. He's not just complicit, Rodell. He is part and parcel of the issue. Somebody got the system to check these block and parcel numbers for me. Please do so. This is the problem. Our people are too easy to be fooled. They're rubber stamping these applications. When you're dealing with the likes of Nydia, you better put on your friggin' investigative and thinking cap. Because one thing with them is they know how to scam people. and they're gonna do it. So who is accepting these applications, rubber stamping applications, and don't even know that this block and parcel number is being applied for multiple business licenses, but yet the physical address is different? All these kind of things should be raising red flags that something not right. Scammers. And no, honey child, he's not just complacent. He knows exactly what's going on, and he is permitting her to do it. Give me a second. I can dig a little bit deeper into real deals. Now, I got to pay for this search because this one not really free. But anyway, but I can pay for it because I want to know. I want to know. Let me see here, company search. Yep. I want to know who the hell these real deal people is. I want to see who his business partners are, and we gonna find that out here today. Y'all sit there thinking we joking. Let's see. Yeah. Okay, give me 1 second. This is information you can get access to. We're gonna proceed to the website, and we're gonna log in. Yes, honey child. I don't know. This thing is always so funny. But what? Enter registration password, and then I don't want to take it. Hold on. Oh Lord. Every time you come in here, you gotta redo this, you know. All right, give me 1 second. We can double check this now because I inquiring minds want to know. I can get this information there right now. But this is the situation. This is the scamming, folks, that is happening. Let me see here now. I don't know why I'm company registrar, public records. Okay. We're gonna search struck off application, beneficial ownership. Advantage. No, hold on. Oh Lord, give me 1 second. All right. Beneficial interests, ownership, transparency, access restriction, registration. Hold on, honey child. Where on earth is it? Company register. Okay, give me a second. They look like they changed up something here, man. Because I want to see who else is involved with him into this business. All right, give me 1 second. I gotta ask my people to send me the direct link because look like they changed up the website, got it all kind of confused. 1 second. Looking for the direct link. All right, so give me 1 second. I need to find the direct link to be able to do this search because the one I had before isn't working based on what I can see here. Yeah, it looked like they purchase certificate of good standing, file and annual return. Look like they changed things up, you know. Something they got you redirected to another website. So beneficial Oh, CBP now. Oh, that's interesting. Oh God, why don't they tell people when they're making all these changes? It would really be helpful to us. They change all this stuff up now, and I can't find where you can go anymore and get this information. But we can get to it. I'm gonna check and see who this company is actually, who the beneficial and directors and stuff of this company. Registration and annual fees, company statistics. It should be right here, you know, because for local companies, you can get it. For resident companies. Limited liability company. Where the hell they gonna move things around on the website? Okay. All right, let me, as a matter of fact, let me call them, because this is something I want to get this before the show is over. And it looks like they've somehow moved around their website. And so let me see if they can give us some directions on where to find it real quick. Sometimes they don't like to answer their phone, but let's see if today is going to be an exception to that. It would not be an exception. I don't know what I was thinking. Okay, I'm gonna tomorrow at 10 o'clock. Oh, good. You don't even have voicemail that can pick up or what? No, sir. Oh my God. No voicemail, no nothing? What a hot mess. No boy, this one different. Okay. All right, no bond, definitely not answering that. Not even voicemail can answer it for you today. All right, let me see if I can behind the scenes try to get to someone over there. Trying to look at my emails here as well. Lord. Yeah, I don't know what they've done to the website, but the website is like totally redone now. It's not totally redone, but it looks like they've moved some stuff around. And as a result of that, you can't find nothing. General registry. Okay, we have a list of team leaders, partnerships. Let me see here. There was one lady over there that was actually really, really good. I can't remember her name now. Okay, let me see who. I don't know where these people have gone to. But they're definitely not answering the phone. All right, let me. I'll work on this because I'm curious now to know. Oh yes, here's one here from. Good morning. Did the URL site location move to check out the register local company details such as directors, shareholders. I cannot find it today on the website. If you can provide the direct link /URL, I would be most grateful. Kind regards, Sandra Hill. All right, let's see if we can get a hold of somebody through email then. Okay. All right, so very good. So there's that. Okay, let's find out who the beneficial owners and directors of Real Deal actually is. But like I said, very, very confusing here that they have actually changed. Although the block and parcel remains the same, the physical address is somehow different. So I don't know what that's about. Damon says nobody ever answers at WRC. Well, we weren't even calling them. DAT27 says good luck with calling DCI. Lord have mercy. They could really do better with the phones. Rodell says qualified human trafficking in the Cayman Islands must be a life imprisonment without parole. I agree, because the problem that you see, this is where people like Lamardo and his simplicity really doesn't understand what his wife is doing, right? He believes that this is innocent. You're just charging people a pile of money to get here. But remember that when they get here, they have no jobs, okay? No jobs whatsoever. And so if they don't have a job, what do you think they're going to do when they get here? Anything that they can to make money. And that will include illegal behavior. So we cannot encourage people, as expensive as a jurisdiction as Cayman is, we cannot encourage people to come from somewhere else. They don't have no place to stay. They don't have no jobs, no nothing lined up, no legitimate work, but they're being brought in on a work permit. Very, very egregious situation. Ms. Debbie says we're literally screwed. Literally, as opposed to figuratively, yes. Give me one quick second here. I'm queuing up the picture for our next segment. But yes, my dear, we are literally screwed. And what I'm going to tell you is, if we don't get a hold of this, it's just ridiculous. So apparently somebody contacted CNB, but they're confused. There's no reason they should be kind of confused unless they're kind of simple. Well, how are y'all confused? The bank is making you an offer to not pay your mortgage for 2 months. The bank has the right to do that, and you have the right to accept or not accept. There's nothing confusing about this. What I suggested is, unless you absolutely need it, it is not in your best interest to accept it. That's my opinion. How is that confusing you? That has nothing to do with what CNB is offering you. But y'all love to believe you're getting something for free when you're actually not. That's why Caymanans will only go so far, you know. Because we're not using this. Somebody says, let's just move on from that, because they not got no sense. All right, so give me a minute. I will get the link, and I'm going to look up who actually owns the company. Let's talk about the next scammer, this dude here, because we sure can find them. Louise says, so many Caymanians seeing many Filipinos involved in scandals and can't do anything about it. Why are they most mentioned here? Don't trust any of them who would smile with you. I don't condemn all of them, but this is very alarming. Filipinos, please behave yourselves in this country that welcomes you and feeds you. I know all nationalities have bad and good people, but recently I'm hearing more about these types of people. Please behave and stop scamming this country or taking advantage. To be clear, Luis, I made it very, very clear yesterday. They're not the only ones. Jamaicans do it too. You know, I've lost count up to a couple days ago. This one was messaging me, oh, you know, this guy took my money. He didn't take out a work permit for me. They're doing it as well. And we have featured them in the past. Right now, the week of the flavor of the week just happens to be the Filipino community. And this is a big case. And this all came about, to put it in context. This all came about. Thank you, Anthony. This all came about because of a video that was sent to us with a Filipino girl and her Trini, now with probably PR, boyfriend, Ryan Kirk Muhammad, fighting in public. And then she had the nerves to call in on the show. And when she called in, people recognized who she was. And her and the brother both got exposed because the brother's here after lying in his work permit application. He has a conviction for distributing pornography in the Philippines, and we still let him in. And they both out here looking at people, man, because he looking at your man, and so is she. I guess they're making sure not to see man. I mean, I don't know how they work that out, right? And then when I'm like, how did she get to Cayman? That is now where we get to Lamardo and his wife. So when you start digging, the septic tanker was getting stinker and stinker the more I dug. And so we dug up now, what his name there? Lamardo and his wife playing a big part of this whole scamming situation. Yeah. Living their best lives on the back of people, hardworking Filipinos who are desperate to come here. See the two of them there? Always partying and traveling and having a great time. Lamardo never had life so easy, but you're scamming people off of it. And so that is a problem. It's illegal, unlawful, and it should not be allowed. WRC needs to answer some questions now. Supposedly, they're going to be issuing a statement because we know for a fact that they were investigating this couple in LSJ recruitment from years ago. So, some Filipinos have come forward and given statements. So what has happened? Why are they still in business to be able to do this? Yeah, Rodell, the rabbit hole was very deep with this one. So, I mean, somebody need to tell Michelle her biggest mistake was calling me that day. Mind you, I tried to warn that boyfriend, you know. Remember when Ryan said, oh, you know, I'll have her call you. I said, I wouldn't suggest you do that. Now, I didn't know all this shit was going on. I just said it because I knew that what she was going to be telling me is just stupidity and ridiculousness. Little did I know how ridiculous her statements were going to get, and that she was going to be up in here talking about, oh, this man has done more for this community than me. I was like, pump the brakes, sister. He's done so much for this community that he's in court for defrauding the government. You want to rethink that statement? So she opened Pandora's box, and all I'm doing now is I'm ripping the whole box apart and dissecting what is really happening in this country. So that's where these two came in, because they brought her here. For all intents and purposes, because the wife's name is not on the business, it's Lamardo Scott trading as LSJ Recruitment. I'm going to hold the Caymanian responsible for this hot mess and say that Lamardo Scott, he is the one who is bringing these Filipinos here and taking advantage of them. He has the business license, which means that the bank account is in his name. And I don't give a cahoots if his wife is the one with the connections back home and is actually doing the work. Once you put your name on it, Bobo, you are a disgrace to all Caymanians, and this is what we do. This is exactly what we do, and we need to take accountability for this foolishness. Why is it that we're allowing people? That brings us nice segue into the next case. Why are we allowing thieves and scammers to come to this country and we keep them here? Explain it to me, because this is another one. Hold on now. Let's get the 411 on this one. He's in court now for stealing somebody's credit card and spending over $5,400 on their cards. Apple Watch, AirPods, iPhone, gold necklace valued at $2,600. He even went to the automotive shop to buy automotive parts. Warren George Scott. And this is not his first time at the rodeo. The dude has a previous conviction working at FedEx. Wow. No, sir. Huh? Lord God. But guess what? What is keeping him in this country? Caymanian. Now, would it shock you that to know that she's a CBC officer? Honey child, it shouldn't. It shouldn't shock you, not at all. Right? Girl, let me show you what she looked like now. Hold on. CBC officer up in the mix yet again. CBC, y'all need to stop firing some of these bitches. I'm sorry, but honestly. So while she got time now, honey child, to be going out here, Nardicia Reed Scott, while she's out here talking about, oh, she going to get body lift and body work done, and she going to do this and do that, and all this kind of foolishness, she's allowing this no good man who's stolen on multiple occasions to remain in the jurisdiction. But I need y'all to come a little bit closer. Yeah, strong will, strong. This is what you say? Come a little bit closer. Miss Brenda, they're not getting deported because these Caymanian are telling you no good SOBs, right? Are defending them and talking foolishness about right to family life. So they're not getting deported because their sponsor, aka the Caymanian spouses, are allowing them to stay here and do all kind of foolishness. Yes, honey child. Now, I have a theory, and we're going to get to that theory here in a second, about what is really going on around here. But here she is, looking all cute and prim and proper. But here's the joke. She tells people, oh, she can't get a divorce from him because he won't sign the papers. Now, you know, people not got no sense, right? You know, people are just stupid. I said this to you guys yesterday. No one can force you to stay in a relationship. Oh, yeah, they're not together. He doesn't want to sign the divorce papers. Are you kidding me? Are you really kidding me? You can get a divorce even though the other person doesn't want it. What system would allow you to be forced to stay in a marriage? If you don't want a person no more, no system in the world, because that's like communism. You can get a divorce although he don't want to sign, but no, that's not what's going on here. What's going on here? She's out there living her best life. She's interested in women. And I got no problem against lesbianism, right? I'm just giving you all the cold hard facts. So she's able to go out here and live her best lesbian life, licking up somebody's kitty. And then he's out in the streets, boning down the place, screwing everybody and everything. And it's no problem because this is arrangement. She just need him there to have a little job to help pay the bills so she can go and get her body done. And so she can chase cat all over Cayman and whatever. But this is the very definition of a marriage of convenience, of a fraudulent marriage. And this is where, as a CBC officer, you should be ashamed of yourself. But y'all not got no shame. You not got no compunction. You not got nothing about you. This is where we have got to put a stop to this nonsense. Oh, well, he can contribute and he can pay the rent. How are you going to talk about, oh, he don't want to sign divorce papers? Well, there was a time when I was separated from my ex-husband. We weren't formally divorced, but I also was not living in the same house with him, talking about he must pay the bills. I put myself in a position where I could get him out of the house, buy him out. Or in your case, go find someplace else to rent. How is it that the two of you are both residing at the same address in Spots Newlands? And meanwhile, because he can't get and keep a job, y'all know that already. I'm not going to tell you that story. What is he doing? He's staying home all day, smoking pot and getting high. And when he does get a job, he lying to the people about how he get the job or his court charges and this and that. Y'all need to come together now. Come and have a coming to Jesus moment, because y'all have got to do better. Caymanians, you are literally destroying your own country. You're doing it. There's only so much that we can blame on the expats, because they are doing what we allow them to do, whether it's a Filipino or in this case, a Jamaican. We allow people to come here and use and abuse the system. And in fact, we help them, by entering fraudulent marriages, fraudulent situations, deceiving the government, getting them jobs. And here's the best part. They can't even behave themselves. You can imagine? You are, let me try and have this sink in, right? Because this don't make no sense. You get an opportunity to come to the beautiful Cayman Islands. Everybody wants to be here. Okay? And you get to work and you get to, have a good job, opportunities that you're not going to have back in your own country. And all you have to do is walk the straight and narrow path and behave yourself. And you are so incapable of doing that you're stealing from people, as in this Warren Scott guy, scamming people, as in the Filipino wife. It's just like, what the hell? No, sir. Y'all should not be even wearing these uniforms, because you're a disgrace to the country, putting you in an enforcement position where you are supposedly trying to enforce things against other people when other people know what you are is a disgrace. You should be ashamed of yourself if you had any shame. Nardicia M. Scott, come on, girl. What the hell are you doing with this man? Hiding behind the Reed last name not gonna help you none whatsoever. Why do you have this no good man continuing to be, and by the way, not for nothing, but she used to work RCIPS as a communications officer? Take that. How stupid are we? But why are you out here worried about getting goody body and this and that? You have this criminal who is right here amongst us, taking advantage, making you look bad, but you not got enough sense to know. He hiding. He's taking down his social media. So we couldn't find him. Tell him we got sources, we got people. In every nook and cranny, we got people, girl. Yes, we do. He can't hide from us. We can find him. Just like we found you too. Stop the nonsense, girl. Really and truly. Yep. We got more pictures of you than we know what to do with. And we got pictures of him too. Why? This is it. That's my question. Why? Why is he still here when he's already proving himself to be a thief? Jamaica has over 3 million people, girl. If you really like the diddly widdly, go find another one. You're gonna be like some family members. We got you around, yeah. 5, 6 men later, marriages, and countless in between. That goes to show you how easy you can find one. I'm just saying. It can't be that hard. Yep. Stealing. In court again for using somebody's credit card. Now, I don't know this man from the man in the moon, just like I don't know her either. I think she family to them people down in probably the east or something like that. She probably a cousin, as far as I know. Somebody was telling me yesterday at the airport who her mom is, but I don't really know people like that. But anyway, let me just see here now. Yes, honey child. I soon find out. Because y'all told me that she came out in. Yeah, she came out in. One of us. Can't deny them all, honey child. But anywho, she one of us. So yeah, so she don't want to get rid of this man. And I'm just like, why? Because you can't pay that rent on your own? What the hell? Really? Her mom is in the comment section. Oh, let me see where she is. Let me see. Who's the mama? Mama, come and identify yourself. Delene Hurlston? Oh, Miss Delene, good morning. Yeah, I'm her mother. She's a born fucking man. Well, Dana, no problem. Nobody, Miss Delene, nobody not coming for you. We just have some serious questions for your daughter. But thank you for confirming that you're her daughter, that you're her mother, because now we know exactly who's who and what's what. But yeah, okay, he not paying the rent. Why does she have him sitting home all day smoking pot and doing nothing? What value? Because like I said, she's not interested in a relationship with him, supposedly. She's telling people that, he won't sign the divorce papers. So you will have a man living with you being a burden to you. Talking about he don't want to sign divorce papers and embarrassing you out here and stealing from people? You cannot think that this is a good idea in any way, shape, or form. He about to go to jail. And then what your daughter gonna do then when he go to jail? What good that gonna be doing her? As Caymanians, Mr. Lean, nobody not better than nobody else, but we need to make better decisions. Our inability to make good decisions and marrying these men for all the wrong reasons is why we are where we are. Someone says, only in Cayman, we don't have anyone to blame but ourselves. That's exactly the problem. So don't come here up in your feelings. I'm just pointing out the obvious. The truth. Is there anything that I have said that isn't true this morning? No. There has to be some degree of accountability. I must get my facts straight. Okay, what facts is wrong? What part of what has been said not straight? So we can iron it out. Let's do it now. What part not straight? Did he not sit home smoking pot all day? Is that part not straight? Did he keep stealing from people? This is not his first time in court for theft? Why did FedEx fire his ass? He got 1 million excuses. He got more excuses than Quaker got oats. Okay, why says she probably indulging the scamming? Well, y'all like to defend too much fuckery. That's what I know. Y'all defend a lot of foolishness. Miss Deline, I'm not trying to be disrespectful to you, but I'm waiting here for what facts you claim not straight. Okay, so the excuse is what she has always done, work and do what she always did. FYI, she's not the first and surely won't be the last. That's it. That's the best we got. That's the facts that we try to set straight. Nobody not saying that your daughter not working. That's not the point. The point is, somehow she has picked up a no good Jamaican. That not debatable. When you about to get your second conviction for theft and can't keep a job because of that. Yeah? I think it's pretty clear that he not no good. So let's accept that position. Shawnette, you the sister? Well, you come on through, honey child. So if we accept that position, why is she keeping him? What's the benefit? Like I said, she's out here dating whoever she wants, and that's her prerogative. But what you don't do, because when you go check the immigration law says, if this is not a bona fide relationship, you need to notify us so we can cancel his RERC and get him off of this island. That is in the law. They sign an affidavit. When you marry a foreign national, you sign an affidavit that requires you to tell immigration, WORC, when the marriage has broken down. So you're saying now that she's the victim. Okay. This is where I'm having a problem understanding how can she be a victim of this man when she's out here doing whatever she wants to do. And she's keeping him here. You can't be a victim when you've never notified WRC that the marriage is broken down and that you no longer want him. Whether he wants to sign a divorce paper or not, you can get a divorce. This don't make no sense. I'm not convinced that she's a victim. We need to do better. We have really, really got to do better. Her sister said that's heresy. Number one, she doesn't pay rent. Okay. So he don't contribute to any of the bills then, and that's not why she's keeping him here. All right. Number two, he was fired from FedEx for stealing. I think we said that. He was fired for FedEx for stealing? Okay. And then he blaming that on somebody else too, because of course he's not going to take no accountability for his behavior. What a hot mess. Wow. It's sad. Very, very sad. He was at Brand Source. They let him go. He's skipping around jobs because, of course, once people find out that he's a thief and he's a convict, he's not going to be able to keep no job. Went and took down his social media account so we couldn't find him. I wonder if that gold chain that he's wearing is the one he stole, that he bought for $2,600 with the stolen card. What y'all think? Who's willing to take some bets on that? What a hot mess y'all in. Such a shame on CBC part as well. We have good, decent young men and women applying for these jobs, yet not even a response from their office in almost a damn year, yet they can hire such individuals. Why? I reckon CBC might be asking some questions here today. That's all I can say on that part, because they need to. Y'all don't understand that you're actually breaking the law, you know. I think y'all understand it. But because there has never been any consequences for doing so, it seems like, you know, you just get away with it and you don't care. Such a sad state. Ms. Brenda says CBC officers have been terminated for far less than that, but I guess it depends on who it is. That's the kind of stuff that's being done to Caymanians by their own government. Jess says they're not getting deported because the law is not being applied, because they've been many families that have been split because of deportation. Why are they so special now? Strong wants to know, how do they get these kind of jobs? Yes, what a mess. Ay, ay, ay. Strong Will says, Auntie, you're killing me this morning. I'm cooking, my pot burning up. Oh, Lord, don't burn the food. Next person says, hey, CBC hired by favoritism. I applied several times and never heard back. Yet I applied once in the UK and got it. What a mess. And you know, the worst part of all of this, to be honest, right, is, you know, it makes us all look bad because every day we sit here fighting for Caymanians to get jobs, to get job opportunities, especially with government. Oh, you know, we got put in the rollover for the expats. It should only be governments working, should only be Caymanians working for government, blah, 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 blah. But then when y'all get these government jobs, which are, you know, they might be the highest paying jobs in the world, but when you consider the benefits that you get, you don't have to pay for health insurance, you don't have to take out pension, et cetera, it's decent. And y'all still go in there and fucking it up. Y'all still go in there and making us look shame and disgraceful. Making us all look bad. Not good, none at all. What a mess. Shame, 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 says this other person. I not defend these. I don't claim these scammers, says KY forever. Shanette says, sister and proud. Good for you. I mean, that's great. That's fine. But that don't mean that what she's doing isn't wrong by keeping him here in Cayman. You know what I'm saying? Ride for your sister, but you still can't defend wrong. Right is right and wrong is wrong. And sometimes things are very black and white. Sandra, get your facts straight. I didn't say she's the victim. Maybe what you need to do is you need to write straight. What's the point of, I don't understand your post then. Why is she highlighted? Is she the victim? What does that mean then? That mean that you're not making no damn sense. So you're not saying that she's the victim. You're questioning, is she the victim? We're not talking about no victims here. That's why I said she's not a victim. But maybe what you need to do, instead of telling me that to get my facts straight, maybe you need to try and learn how to write better so I can understand what the fuck you're saying. That would be great. How about that? I mean, did anybody else interpret that any differently? Mr. Lee, like I said, I'm not trying to be disrespectful, and God knows I'm not trying to come for you. I am just trying to say that what you're saying now don't make no sense. I'm confused. Fix it, Jesus. Vicky says, me not do a thing for Reach Pond Mall Road. It's so easy to not get over here, but y'all just, I don't know. Yep, people be good and don't reach on Mall Road. It's so simple. Gotta change your nationality, says Miss Brenda. Sheriff Sandy for Cayman people, all the dirty shit coming out. Real Deal says too many of our people are the problem. That includes those that enable them. Morning, Siobhan. Miss Joy says FedEx again. Trying to look rich. That's why I love my cheap life. Living, work, stay in my bed. Poor FedEx boy. They ain't even getting tarnished by these people. No, sir. I got to get the details on the FedEx situation because I can't remember all the details on that one. So I'll soon get that. But of course he claims, say, he actually told somebody yesterday that I wrote the article. Mind you, I didn't even write the article. Yeah, I did not write the article. We have a reporter that covers a lot of the court stuff and not me writing it. And sometimes I don't even know that it's up. And that was the case here. On Saturday, somebody said to me, that story that you just wrote with this guy, here's his picture. So I edited it with his photo, but I did not write the article. I didn't know nothing about it. I don't know nothing about him. This came to light after it was written. But he go around telling people that I put him up because apparently I have some relative that work FedEx. Me have a relative that work FedEx? I don't know nothing about that. But I think all of you have been here on this program and listening long enough to know that even if I did have a relative that worked FedEx, that I got nothing to do with nothing. Because my own relatives have been called out the same way for some of them doing the same foolishness. Because some of them have engaged in these same fraudulent marriages and relationships as well. And I talk about them same way, and I report on them the same way. Nobody gets a pass. Because this is not about hating on people. Yeah? This is not about, oh, she don't like me because I'm a Jamaican. Oh, she don't like me because I'm from West Bay. Oh, she don't like me because I'm so-and-so friend or family. No. Most y'all bitches, I don't even know. Because I don't live out in these streets like that. It has to do with the fact that this country is only so big. And if we want to protect it, we want to protect its integrity, and we want to protect it so that we can all prosper and get a little bit of the piece of pie. The only way we can do that, folks, is stamp out corruption in our country. And so what is good for the goose is good for the gander. Whether it's the fact that you got 9 companies that you claim that you are 9 companies that you claim that you're trying to run a scam here in this country from your Filipino wife, or if you're stealing and you're only staying here out of a marriage of convenience, whatever the situation is, it doesn't matter to me. That's why y'all shouldn't take it personal, right? Because this is about country first. Let's do what is in the best interest of all of us as Caymanians. And what is in the best interest of all of us as Caymanians is not to have the criminal element enter this country in no way, shape, or form. Whether you're a thief, a child molester, a murderer, a scammer, whatever, we don't want you here. We got enough of our homegrown that fall into that category, and we don't have nowhere to ship them off to. Because trust and believe, I would love to put them on a boat and send them somewhere like how Trump deporting people. I wish we could deport them, but we got to keep them because they belong to us. Northward Prison is full, busting at the seams. Fairbanks, the same thing. So why are we importing badness into this country? Scammers, thieves. That don't make no sense. So it is what it is. And like I said, y'all don't have to like it. But one thing I know for sure, it's not gonna stop. Let us do our best to try to keep and uplift this country. Huh? Everyone does their little part. We would all be in a better position. But that's not what's happening. Heaven forbid that we should have standards in Cayman. Oh no, we can't do that. Heaven forbid that we should try to hold each other accountable. Oh, that old Sandra, she thinks she better than somebody else. And blah, blah, blah. It's like, really? That's what y'all think? I mean, you don't got no sense? Because we come from the same place. Like I said, this young lady is probably a cousin when you go look at it. I don't know who her mom is, but I'm sure we probably related somewhere down the line, and it don't make no difference. What I'm saying is we need to do better. All of us. When I see people in my own family doing foolishness, I try to talk to them the same way, you know? As a matter of fact, just a few days ago, I had someone come to me and report something. It turns out it was a family member that they were reporting on. And I said the best thing, because it's a very serious allegation, I said the best thing is that the police deal with this matter. And you better believe I didn't even think twice about forwarding the details to the RCIPS and make them handle a proper investigation. And if what is being alleged is true, the person should be arrested and their backside should go to jail. As simple as that. I can't protect nobody in this country who's doing wrong. That's why I tell my husband, I said, look here now, let's get it straight. He not a caliber that some of y'all importing, right? I'm just saying, some of y'all importing all kind of riffraff. But even so, the day that he step up and do something stupid and break any laws here in the Cayman Islands, he done know the position. See Jamaica right there, so? The flight is only 45 minutes by plane. So you're going to have to pack up and leave. That will be the outcome if you screw up. So before you go out there doing any bullshit, try to remember what you have to lose. Because I ain't not the one standing by no man. I ain't not bringing no criminals in this country. And if their backside goes to northward, like I tell y'all, I'm not built for Northward or Fairbanks, and I'm not even built to visit there. So don't count on no visitation from me either. I ain't not been there to visit nobody yet, and I certainly not starting at my age. So y'all gonna be out of luck. Miss Brenda, like I said, I don't tend to cover much court stuff at all. I'll have to ask Renee what's going on with that murder case. It is a jury trial, so we can't really say, we can only kind of report on factually what's happening. I wouldn't be able to discuss it once the trial has started here anyway. But I'll message Renee and see if she has any updated posts or whatever to put about it so we can get that. Miss Lucille says, that's why I don't write no more. I cannot spell. Laughing out loud. If I was her sister, I wouldn't be proud, says KY Forever. She ain't a sister to be hyped about, to be honest. What a hot mess. Louise says, Sandra, thanks for letting me know the truth. Well, honey child, we here every day digging for that. Louise goes on to say, why don't you run for permit? No, Bobo. I believe you have all the support. What you stand for? No. Let me tell you two reasons. Number one, nobody couldn't pay me to do that job because most of it is just people trying to backstab you in politics and you can't really get nothing done. So it's like you have a position and title, but try and get stuff done. That's a whole different situation. I'm an action person. I believe in getting shit done. So for that reason alone, me in politics we can't break bread. There was a time when I believed the way to get something done was by political office. I no longer believe that. Okay. Number two, right? What we're able to do here through this program and through this platform, the action that we get is far more effective than any politician. That's why the politicians who got sense reaches out to me and say, Sandy, we got to move the needle on this issue. We got to do this. How can you help us? Communicating with the people, getting their feedback, highlighting these things. So, Luis, I got the best job in the world right here. Bibik says, good morning. Can anyone tell me the law of changing the permit to own company? I'm not quite sure I understand what that means. Changing the permit to, you want to own a company or you want to work for another company? They soon cut that out completely, Bibik, where you're not going to be able to change jobs like that because that's part of the scamming that's happening here, which is quite sad. We can transfer them to the UK prison. No. They only will take the most serious, like murderers, and they have to have special reasons why. And so you see, when they had appealed it, the reason that we were able to arguably say, yes, those two have to stay there is because the authorities were able to show that despite the fact that they were incarcerated, they still had so much power, criminal power, that being incarcerated wasn't stopping their criminal activity. That is why they're still in the UK. And guess what? Even there, it wasn't stopping them. Because one of those Caymanians there actually had a girlfriend that worked in the prison system, or her sister, some mixed-up story, and was paying for stuff in the background to still be done. So y'all sit there, these people getting serious now, boy. Siobhan says when people do something wrong, it's like they want people to swipe it under the rug and not be held accountable. They get upset. Just do the right thing. I don't know why that's so hard for people. I know I'm not supporting no wrongdoing. Amen and hallelujah. Damien says, now we have an MP for immigration to protect everyone in Caymanians. Takes time to take effect after 30 years of the gates being left open. Siobhan says, I think even Marlon, she'll hold accountable. Hello, you better believe it. If he messes up as well. So no one is being left out. Trust me. And you got to tell people straight from the minute they get here. You know, I've had 2 expat husbands now, and the first one, may he rest in peace. He was a really nice guy. He was actually a prison officer. No harm to nobody. But, you know, when people come to my country, just in case they fall down and hit their heads and forget how things work, I remind them that, yes, you might be here working in this country, but you're here by invitation. And so therefore, you should act accordingly. I know I told y'all this story before of when the sister came to visit, my sister-in-law at the time. And she was, you know, some white people they kind of simple. And she was talking to some other lady who was also a bird watcher out in East End, and she telling her, oh, when you come to the Cayman Islands, they've got people living in the bushes, like they run around, you know. I was like, what? Cayman? I'm like, what country is she talking about? Are you sure are you sure you told her the Cayman Islands was where you were coming? And she not in some other country, because that not Cayman. That don't make no sense. I don't know what the hell you're talking about. And when she sat at my dining room table and start talking this foolishness, basically insulting me. And I'm like, we have the best housing infrastructure in the entire region. That's why, yes, when a hurricane lick us, we get lick, but we come back quick time. I'm like, what are you talking about? Oh, you guys have people live in the bushes. I said, look here, don't sit at my dining room table and insult me with stupidity and nonsense. You got to set people straight and tell them. But how stupid would I look as a Caymanian if I'm part and parcel of the problem? That can't work. No, sir. So, y'all, you can continue to do like them old people say. You can do what you want to do, but you're not gonna do it forever. Y'all are going to be exposed. So, what your name is again? Nardia. What the heck her name is? Let me help you out here. Nardicia. Let me help you out, TD. Yacleem say he won't sign divorce papers. Somebody reliably informed me yesterday that government even offers resources to people who work for them, who, you know, wish to get these legal services and they say they can't afford it or this or that and blah, 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 right? That they offer these services where they will assist you in getting legal advice and you can file for your divorce papers. Okay, TD, this is what we're going to do today. You claim, say you can't get the help, right? All you have to do, okay? Very, very simple. You write into WORC and you say, this marriage has broken down. It's no longer a real relationship. It's not working, whatever. That's the first step. By law, you're supposed to legally inform them. The second step is you can get assistance. You can even apply for financial aid. Yes, you can. Not financial aid, what's it called? Legal aid, to be able to get your divorce. So if you can't afford it, we can help you. The government has things in place to help you. It's as simple as that. Mm-hmm. Yep. All right, honey child. That's what it is. Unbelievable from her comments. No wonder she's the way that she is. That's why they are the way they are. Children. Mm-hmm. Good morning. Can you ask them to pick up from... Okay, do we know anybody knows Rowan, R-H-O-A-N Myers Jr.? If you know him, please let him know that we have his work ID. As a matter of fact, I can just message. I know people at his workplace. I can just message them. All right. Good morning, San. The Pinots called a town hall meeting years ago with our government PPM or UDP, wanting to know their rights in Cayman, and ever since, they feels like they own these islands. Some of them not too bad, but that is the older ones that came here years ago. But these younger ones are getting rich fast and don't know how. Someone asked if your PR/married to Caymanian was pulled or canceled. How is it possible for the person to re-enter Cayman without a permit? I do believe they have a valid Cayman passport. Any and everyone is getting in. Cayman CBC is not doing their job. What a heat. What a hot mess. Hi, Sandy. Let's see here now. Okay. A few more comments and then we're going to go ahead and end the program. This person says, no wonder it's alleged that there's lots of scamming going on in CBC and WORC. Crap like this will continue until culprits are arrested and charged. And that's where the problem lies. And the enforcement arm are not catching these people. And even if caught, cases are mishandled and evidence linking to the charges would get cases thrown out. No more training. Sorry. What does someone say? Hold on one second. Oh yeah, Instagram restarted. Hold on one second. What is charges is now coming through about Caribbean people again? Oh Lord, have mercy. What a mess. Making a name for ourselves, boy. I gotta read up on that story. Charged. Okay, so this one says, just trying to read this while I do something else on this other screen. Okay, cases thrown out. Some more training is required and definitely more staffing and the desire to go out and catch these people. Delene found Jesus now. Oh, she did? Oh God, I'd hate to see if she hadn't found him. But back in the day, she behaved similar to the 9 companies case you were talking about before. She was doing similar, just didn't get caught. She took advantage of so many Jamaicans, my dear. Oh, please. We are our worst enemies. Too much friend, and family too. Snaps. The problem is that the operational arm of government has no clue of the importance of their job. They show up, rubber stamp, and absolutely no clue or care because there's no accountability. Thinking about it, we can't blame the staff when the entire government system lacks a lot of proper processes, checks and balances. Hence, there are allegations of scams going on with some of the departments, and they're hard to detect. Miss Lucille, you making me laugh. Oh, that was the same one. All right. Yes, thank you, Miss Brenda. That was the quote I was looking for. You can do anything as much as you want, but not for as long as you want. That's right. That is right. The bucket can fall out one day when you're taking it to well. here's a good one. Thank you, ma'am. 1 second. Let's just grab this. This person had the following to say. When I got divorced from my ex-husband, I wrote a letter to notify them that I will be filing. Wrote one when I filed and wrote again with the divorce decree. He never showed up one court date or responded to anything that was served, and I was granted my divorce. Him not showing up made it easier for me. Yeah, this is foolishness. When people talk about, oh, he don't want to sign, that is people who are looking for an excuse to not get divorced, but they can't fool me because I know enough about the legal system to know better. So when I heard that, I just laughed out loud. When somebody went, oh, she wanted to divorce him, but he didn't want to sign the papers. I said, please, that people who think you're stupid. That the only way you can make a comment like that to somebody, because you say that people dumber than you. And that are the case. Of course you can get a divorce. They don't have to participate or show up, none at all, like the person said. That makes your life easier. Sure. I'm all here for it. A lot of mercy. All right. Oh my God. My apologies. Folks, we can keep on top of it. Like I said, we have a lot more cases that will be highlighted. We are digging deeper. If you are a victim of the Filipino Lamardo Scott and his wife, please reach out. We've had more of their victims coming forward. I can tell you people got story for days about the two of them. And so we will get as much information together. Because if we got help the authorities do their investigation, well, then it is what it is. That's all I can tell you. All right. So we will stay on top of it. But it's a hot mess. Oh my God, it's a whole story, and then it's a lot with them. The only thing that shouldn't shock and surprise me, but still does, is how is it the CBC has not, or WRC has not put these people in jail yet? Like how? My God. No wonder they feel like they can get away with anything. Lamardo, you up in your feelings. Sorry for you. But you sat back for years and allowed this level of profiteering off the backs of poor people. You just lucky that them Filipinos are very docile people, because somebody would have come for you and your wife a long time ago and give you one good slap upside your head. Instead, they're like Michelle. When they come here, they have to focus so much on hustling and making money out in these streets. That's what's going on. It's madness. All right, beautiful folks. Please enjoy the rest of your day. Work hard. Again, if you are married to an expat and you're no longer in a relationship with them, although you've not got a formal divorce, you have a legal obligation to notify in writing WORC that the marriage has fallen apart. Okay? Tell WRC and then go and get your divorce, because this is what happens. Y'all stay married to them, just like this Nardicia, whatever her name is, and then heaven forbid something happens to her. All of a sudden, this man who is a convict, who is a thief, he's going to go now and be able to get her government pension. Her mother claims that she's not paying rent, so I guess she telling me that the house in Savannah is for her. He gonna take our house. He gonna get all these benefits because she couldn't be bothered to get a divorce. Y'all need to be thinking smarter for yourselves too. Right? And your children not gonna get nothing. He gonna get it all. And then y'all gonna be trying to fight him down and complain about, oh, he shouldn't get her pension, this and that. That's because you're not following what you're supposed to do. Brenda says, keep exposing the facts about them, then send it all to immigration, Wesley Howell and Minister Miles. Marshall says CBC aren't doing anything about it. So many of these scammers, because they're friend. Miss Brenda says, yes, it's broken down and no longer stable and intact. Just tell him the truth that you are living your best life, being single and ready to mingle, and so is he. On that note, beautiful people, have a lovely day. See you tomorrow. Bye-bye.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.